Okay. Um, so good morning, the people on this side of the oceans, and good morning, the people back home. Our conversation today is on it's a follow-up after the conversation we had on infertility some months back. Some people asked us to just do this bit. So our conversation will be on alternative paths to getting children. I don't know if that's a correct word, but let's just go with that. And so as usual, Saya will open the studio and then we will go on from there. So Saya, you're up.
Okay, good morning for those who are on this side of the Atlantic, and good evening or good whatever time zone you are in. My name is Saya Jackson. I am a transitions coach, and what I do is I help individuals build new maps to navigate the new worlds they are going into so that they can thrive without losing voice, vision, or values. The one fascinating Roman emperor is Emperor Nero. His mother was called Agrippina. What's interesting is Nero was not the biological son of his father. It said he was Agrippina's child, but the emperor liked him. But the emperor had a child, and Agrippina colluded partly, and in Roman times, poisoning and funny deaths were pretty normal, were things that happened. There was a lot of intrigue in those days. And so the emperor, who having accepted Nero almost as a child, passes on, but Agrippina had made sure that any would-be heirs to the throne had been eliminated. And so came the pathway for her son to rise to power. Nero's reign will not be remembered in glory. It's not really covered in glory, from the incestuous relationship he had with his mother Agrippina to orchestrating the burning down of Rome to he just did many things. And in the mouth or in the memory of many, is remembered his atrocities as a ruler, but for many others is remembered this fact that he was not the biological son, and he'd risen to the top. To use very African, very Kenyanese language, is he stole the blessing, or he stole the star of someone else. This attitude, and of course in philosophy we call it confirmation bias, is not new, and it is not strange to children who've been gotten outside of the normal heterosexual sexual path between a man and a woman. Children gotten in such pathways have been viewed with a mixture of suspicion or just downright contempt. In some settings, they're seen as genuinely threats, and in others, parents who venture into this path are treated with a level of suspicion. But you see, it's not always that way. Many of us know Bill Clinton, the former president of the United States, and Clinton is not his original name. It's a name he took from his adopted family. And Clinton rose to become a source of blessing to the United States and a blessing to his family. These people who push like stories of Nero to make us scared about alternative pathways to parenthood often carefully ignore stories like Bill Clinton as alternative pathways. But whether you're on whichever side of the spectrum you are on, one thing is then sure is that the suspicion alternative pathways to having a child are met with is indication of ignorance. Because what we don't know, we suspect. When Kenyans, way before our colonial masters came on the place, we tended to live within our nations. what we call tribes really are nations, the Luo nation, the Kalenjin nation, the Luya nation. We lived in our nations, and because we didn't know much, especially of nations that were a bit distant from us, we tended to treat nations we didn't know with suspicion. And the same attitude happens to alternative pathways to childhood. There's suspicion about the parents, there's suspicion about the child, there's suspicion about the motives and all of that. Historically, or going to the biblical angle, there have been ways to try and mediate about this whole issue. And in the Mideast culture at that time, where slaves were treated almost as part of family, it was not uncommon, therefore, for women who could not naturally get pregnant to then offer their servant girls to their husbands so that they could get children on their behalf. It was the idea of surrogacy at that point, but as the Bible stories do point to us, those surrogacy arrangements were often met with equally the same amount of suspicion, and in many cases, just downright jealousy. The story of Sarah and Hagar goes down, and the story of Jacob's 2 extra concubines that he got courtesy of his marriage to Rachel and Leah are also robust. And what's interesting is, like in the case of Jacob, the hostility did not just remain among the women, but was also perpetuated subsequently in their children. Africa was a bit more clandestine. In cases where a marriage was not blessed with a child, in Africa, it was not uncommon for mothers-in-law to orchestrate extramarital affairs, especially if the case was the son of the home was the one responsible for this not having a child. Cousins, brothers, or people of close sanguinal relationships would be marshaled behind the scenes to have an affair with a wife so that they could have children. And often this was easy to mask up because in any case, since of the closeness in genes, this child would look just like the father. And in many cases, this would go completely covered. It was their way to try and cover up the entire arrangement. When such covers were blown, matters didn't go down too well. The children were mistreated, in some cases killed. Such women were probably dismissed and shamed at large. But now that we've come of age and the advances we've done in science and the proper application of faith and religion, we still are confronted with the same exact challenges as before about parents who desire to have children, but for one reason or the other cannot have. And we're still dogged with the same challenges of what we don't know, we suspect. I remember the case of I know of a case where a couple could not have children, and when they decided to go down the route of adopting, one well-meaning but poorly speaking individual just spoke to them and say to them, "I heard you bought children." They probably meant it very well, but it cut deep and probably very long. And so we need to just gather around and have this very important conversation. There are legal ramifications, there are myths, there are fears, there are suspicions, ranging as old as the Nero story to maybe as recent as my friend who adopting was seen as purchasing a child. And so in this new minefield that we have to walk through, and yet the challenge is as old as almost humanity itself, we need to have a conscious and a very deliberate conversation around what it takes to have these alternative pathways to having a child and avoiding the extremes of Nero, but being able to probably have the success of having a Bill Clinton. Because who knows, that child that is yet to be born or that child that is waiting to be adopted could just be the next president for fill the blank. And to have this conversation, we join us today. Back to you in studio.
Thank you. So, Madaktari, you're up. So let's just recap the reasons why couples are not able to get pregnant. And I think we will start with the owners of the womb. That's the OBGYN. Dr. Wanjiru Ndegwa, we'll start with you and then we'll go to Dr. Sokwala. And if you could contextualize it in our Kenyan setting, like just recap what we did in fertility. I know it was a 2-hour talk, but 2 minutes almost.
Okay. Thank you so much. It's a pleasure to be here again. And I think this is an important topic, and I'm happy that you've brought it up. And I love the forerunner presentation, because that's amazing how he summarized what it actually means to a couple. Now, I'll just say that surrogacy or gestational, we call it a gestational carrier procedure, is required for a lot of couples. And I will just say that there are two types. He was describing one where traditionally we did it, and that's partial surrogacy, where the woman who carries the womb is also has the genetic material of the baby she's carrying. And then there is what we call now gestational surrogacy, and that is where you have no genetic link to the baby. You are just a carrier of the baby. So there are different types of surrogacy, just so that it's clear. And why we would be performing gestational surrogacy is because of mainly infertility. So you've tried to have a baby and you're not having a baby. So the reasons are very different. One of the basic reasons, which is common sense to everybody, is some women are born with a complete absence of a womb. Now, absence of a womb could be genetic, meaning that there's some genetic syndromes. One that comes to mind is MRKH syndrome, where the woman is born without a womb. She may have ovaries in that syndrome, but she doesn't have any womb. And for that woman, she is genetically a woman. She has ovaries that could actually give us eggs to do an IVF cycle, but is unable then to carry, of course, the pregnancy. So that's one. Another reason why we would not have a womb is it could have been surgically removed. And the reason why, as gynecologists, sometimes we remove the uterus is you could have gone into labor. We need to do an emergency CS. You bleed too much. The uterus is not contracting. We need to remove the womb at that point. We either save your life or remove the womb. And maybe this woman, it's her first child. She'd like other children, but now she's left with ovaries, but no womb. So that's another medical condition. Another reason we would surgically remove the womb is cancers. Right now, with cervical cancer, endometrial cancer, we are removing the womb. And with even breast cancer, if you have estrogen sensitive cancers, we will remove the womb, and ovaries for that type of woman as well. So this is another reason we may remove the womb surgically for this woman. And then there are those women who may go in for a surgical procedure like a myomectomy, that is removal of fibroids from the uterus. And at that point, they bleed, and we're unable to control the bleeding. And for that woman, we would also need to save her life and remove the womb. So those are some of the reasons why we would you would not have a uterus at all. And then there are structural abnormalities that may occur in the uterus. Now, this is where a woman is born with a uterus, but it is abnormal. So you may have a very small uterus that would not be able to carry. You may have a uterus that is oddly shaped. Maybe the uterus is in a pear shape, but we may have a uterus that looks like a T and has no space for the embryo or for the embryo to implant. So that's another one. You may have multiple fibroids, or this is also a structural abnormality where fibroids are sitting everywhere in the uterus, and probably you've tried to conceive or you have repeated miscarriages, and even after removal of the fibroids, the uterus is not able to carry. And then there are patients who have something we call Asherman syndrome, which is also a structural abnormality of the uterus, where sometimes your womb has actually closed, either because of infection. Sometimes it's because of a process we call MVA, where we have repeatedly removed products of conception because you've had repeated miscarriages. So those types of women would require surrogacy because we are not able to then implant. The womb would not be habitable to implantation. And then these women who have severe medical conditions where pregnancy is contraindicated. So women who have cardiac disease, women who have renal disease, and even immunological diseases that may not allow them to carry a pregnancy to term, or where we are worried about the mother's health in terms of her pregnancy. So that's another reason. And the last reason is women who may have recurrent miscarriages. We've had patients who've had 9 miscarriages, 10 miscarriages. And for that woman, then the option would be to have somebody else carry the pregnancy for her. Yeah, so those are just the medical reasons.
And I'm just I'm sharing a picture of the uterus. Yeah. Wanjiru, do you want to, before I usurp your powers?
Yeah, so I think some of these can be corrected, so that not everyone with an abnormal uterus will not carry a pregnancy. So an arcuate uterus, as she's showing, that's a uterus that just has a little. The normal uterus has a triangular shaped cavity, which is the middle aspect. That's the first one. So that's a normal uterus and will be able to carry a pregnancy. But some of these others, especially like the unicornate uterus, may be very small, may not be able to carry. I would have liked a T-shaped uterus, which is that one sometimes is not able to carry, but some of these uteruses are correctable to surgery. And for those patients, we would be able to carry.
Okay, thank you. So Sarah, let's go to you. Just what are the causes of infertility that would lead you to send your patients to Wanjiru?
Yeah, thank you. I think the last session we had a thorough discussion on all the potential endocrine or hormone-related causes of infertility. And although majority of these hormonal problems are reversible and treatable with either hormone replacements or surgical therapies, there are a certain amount of conditions which probably may not be totally reversible or treatable. And then especially those women who have, for example, had a specific hormonal imbalance. For example, let's say, like I have a patient or a family, a husband and wife, whereby, it's not only related to the woman, right? So it's also, there's a component of the male involvement. So we are talking about both adoption and surrogacy, I believe. So when you're looking at that, then there's, for example, a patient I have who actually has a pituitary tumor, and he's a male, and a tumor in the pituitary gland, which is part of the brain, which produces a lot of a lot of the hormones which control your reproductive cycle and all other aspects of the hormonal performances in the body. So we call it a master endocrine hormone gland, right? So he had a big tumor, was done surgery, was removed the tumor, repeated surgery, was done radiotherapy, was done a procedure called CyberKnife. And apparently his other structural parts of his reproductive organs, which includes both the testicles, the penile structures, everything else is completely normal. His semen is okay. But the thing is, because of the hormonal imbalances that he got due to that recurrent problems related to the pituitary tumor, which was recurring, and so he's had multiple procedures done. Even when we are giving him hormonal therapies, we are not able to achieve his sperm levels the way we would want to for a viable pregnancy. At the same time, you would realize that in the process of all this, both the couple, like the husband and the wife, have been growing older, right? Obviously. So it's taken them almost like how many, more than 10 years now in the process of getting him treated. And at the same time, concurrently, they've been trying to get a baby. So now they are both above the age of 40. And at the moment, even the wife's, ovarian reserves are not the same. So she's also not in a position to be able to ovulate. So indirectly, this hormonal abnormality actually led them to a state where now even the wife, the other partner, has become incapable, kind of, in quotes, to be able to conceive. So by the time we are doing all that, so these are some of the potential, patients who like the testicles are okay. It's a patient who you can do like in vitro fertilization and probably consider, you know, surrogacy, or you could even consider aspects of adoption. So that's just one element. It's like irreversible, some of these irreversible causes of endocrinopathies or endocrine disorders. We've got a couple of women who have polycystic ovarian syndrome, which you would hear a lot of such women when they are put on treatment, when they lose their weight, when they do everything that is, you know, recommended, they do conceive, quite a lot of them. But there still is a percentage who, you know, cannot potentially conceive even after we have done everything that requires to be done. And that's another endocrinopathic condition where we might end up having to refer them for consideration of surrogacy or also adoption, you know. So that's the two top of my head. So most of our endocrine conditions otherwise have got aspects that we should look for and treat. And that's why even the gynecologists, when we are looking at things like managing infertility, usually it has to be in correlation with evaluation of endocrinopathies or endocrine problems, hormonal problems, before we say that, okay, fine, this woman cannot get pregnant or this couple cannot get a baby. Yeah, so basically that's when we end up referring to them when we have more or less irreversible causes, or again, when the couple opts for, you know, for going for adoption as they are looking at, for example, getting their own child. So even as a stopgap measure, sometimes because it's quite depressing, sometimes we do recommend or give them the option that, yeah, you could do that, right, as you are continuing workup for these other endocrine causes.
Thank you. You see, your cameo is short and sweet. Okay. 10, because the bulk of the surrogacy is you. You're the one carrying for. Let me back my medic hat on. Unatubeba sisi wote. Okay, so let's start with surrogacy, because I think that's the one that's a bit controversial again in our setting. So let's start. You define for us there are two types. So let's do one and get over and done with it, and then yeah, I will drag in our surrogate carrier. So let's start with the traditional surrogacy. So how does it start? As in just the nitty, what is it? Why do we go there? What exactly happens? And then what do we do it in our setting? Yes, and Ayeta, I'll drag you in because you need to tell us how legal or illegal it is. Anza.
So I will start. Okay, so traditional surrogacy is where, as he said, it was in Bible times, where you would give your slave girl or whoever next to you to carry a hair for your husband, who would then become your child. These days, I mean, it is largely frowned upon, to be honest. We do not do it, but it would be possible to do it either through an artificial insemination, where the husband would give us his material and we would be able to impregnate the girl with simple things like just an insemination when she's ovulating. Alternatively, we could also do it through an IVF cycle, but it's largely not practiced. I don't think many people practice it because I think you bring up too much complexity in that aspect. In terms of the genetics.
Okay, so let me ask you, even in our set, okay, when I used to practice a long time ago, I know patients used to sort of go to the sperm bank in Kenyatta and just get someone, as in especially the ones who discovered that the infertility is male related. They would go to Kenyatta National Hospital and have themselves inseminated by someone who looked like their husband. Is that a traditional sort of surrogacy, or what is that?
So no, that is gamete donation, which is very different from surrogacy. Surrogacy means we're carrying a baby for an intended couple. So it means as a couple, the wife either doesn't have a womb or is not able, or has the medical conditions that I've listed and is unable to carry. So we look for somebody who would then get, in this traditional surrogacy, be impregnated by my husband or whoever in terms of giving the gametes. And then we would either do an intrauterine insemination or even an IVF cycle and put back the embryo in her womb. But at the end, she would then give the baby back to the intended parents.
Oh, got it. And in our setting, are we allowed to, if I donate my eggs, like the egg donors, I don't know if we have egg donors in Kenya, would I, am I able to donate my egg? And if the issue is with a female and they're not able to have ova, and could I donate my egg and then it's fertilized by the husband's what is it called, sperm, and then the carrier bees the wife? Is that still surrogacy?
Yeah, so that would be gestational surrogacy, because there is no genetic link with the surrogate herself in the genetic makeup of the embryo. Okay. So that's still gestational. Yeah.
Okay. So just the difference is between if you're related to this product of conception or not.
Yes, that is the difference.
Okay. Then just talk about gestational surrogacy then.
Yeah, so gestational surrogacy, as we said, is where now the genetic link is to the parents, mostly, or to a gamete or an ovum donation from somebody else. And in this case, the gestational carrier or the lady who is carrying the embryo has no genetic link at all to the embryo that is being formed. For her, she probably the lady, it is a lady who has a problem and she's not able to carry, and therefore we just need the womb to be able to help us along the way and give birth to the baby. So that is gestational surrogacy. So the laws are still, I want Aya to come in, because laws are still very blurry. But the law that is coming up, which is tabled in Parliament, does allow for surrogacy, and does, it has, of course, criteria that we must follow, but it does allow for surrogacy, gestational surrogacy.
Okay. So Damaris, let me drag you in, because you're, just tell us a bit, whatever you're comfortable to telling us about, and whatever is culturally okay with us, because it's a Kenyan setting. Just tell us a bit about your story.
So, like you said, my name is Damaris Rotich. I am from Eldoret, Kenya, but I immigrated 20 years ago. I'm here in America. I live in Texas. I have 2 kiddos of my own. And it took me, I was in that male factor infertility journey for about 5 years before I got my own children. And so during that time, I always said, if I was ever able to have my own kids and I'm able to carry for somebody else, I don't think there's any greater gift I can give somebody. So that's kind of what got me into the surrogacy path. And so I'm a gestational surrogate. So as Dr. Wanjiru just described, the baby that I'm carrying, I have 0 genetic link to. The parents have all the genetic, have all the legal parentage. I have 0 rights to the baby. I had to go through an IVF cycle in order to achieve the pregnancy. And there's so many reasons why these intended parents would focus on the surrogacy, as doctors have mentioned. And most of the common cases, with the miscarriages and the IVF cycle for the surrogate. So there's always the perspective of the parents and the carriers. For me, I have enjoyed my journey so far with educating my Kenyan people, the people around me. I'm in North Carolina visiting right now, and the discussions yesterday with the friends was amazing. I'm loving the questions, because people ask me, will the child be yours? Why are you comfortable giving away a child? I am not giving away my child. I'm giving back the child to the parents. So I consider it as hardcore babysitting. I am babysitting for 9 months. And then I'm just providing that safe environment for a baby to come outside so that they can be with their parents. I am 40 years old, so I'm not the typical surrogate, even here in America. Most surrogates are in their 20s and early 30s. But at the time, I went through an agency. As you know, with America, the laws are very established when it comes to surrogacy. A few states still do not recognize surrogacy contracts. Louisiana, Nebraska, New York has come a long way, especially this year. So, so in Louisiana, if I was a surrogate, the parents that are genetically linked to this baby would have to adopt the baby from me, just because the law does not differentiate between a genetic mother and a birth mother. So in my case, my intended parents are international, but they're doing their process here in America. The IVF clinic is in California, but I reside in Texas. So my OBGYN is in Texas and all of that. But they had to, of course, begin with a relationship with a reproductive endocrinologist, you know, to determine first that what path is most suited for you. And as we know, being a taboo in Kenya, the discussions of infertility and just that cultural focus that, oh, it is the woman's problem. And yet we know very well that 30% is male factor, 30% female factor, 10, you know, so there's the percentage that is both sometimes, and then there's the unknown. But culturally, women were very disadvantaged because we seem to carry the burden. And that's why for my gestational surrogacy, I not only advocate for surrogacy, but also the alternative paths to parenthood, and having these conversations about infertility, because my story could be what helps somebody else say, oh, I haven't considered this path. Or it could be a woman that is focusing on her profession, they're in their 30s, they're not ready to start a family. You don't have to wait. You can freeze your eggs and wait for when you're ready to have a baby, you know, when you have a partner or when you decide to go solo, because that we are in a society where as women, we are empowered. And just the idea of a family, like your brother Posa said, you know, we have to challenge those traditional concepts. It's not what it used to be in the olden age. We are very advanced. So for me, I guess the best way it would be to receive questions from you guys, the panelists, so I can answer, so that I can focus, or else I will just be all over the place. Okay,
so let's start. So Damaris, day one, you decide to become a surrogate. Then you go to, this is the American path. You went to the
So this is the American path.
Okay.
There are hundreds of surrogacy agencies in America. So what I did, I just Googled surrogacy agencies near me. So the ones that came up in Texas, I wasn't able to get a hold of somebody immediately. You know, I was 39 years old, so times are ticking as well. So the one agency that responded to my online inquiry was one in California. And the first thing that you do is to provide, of course, your basic information. And they do a federal background. So I cannot be a felon. I cannot be living with somebody that has a criminal record in order to qualify to be a surrogate. And what a lot of people have a misconception of is, oh, people just do surrogacy for money. By law, actually, you have to be financially stable before you qualify, so that ethically you're not going in for the money. You're going in because of the desire to help somebody. And yes, it is compensated. There is a few that is altruistic, a family member or a friend caring for somebody that is unable to, but the compensated aspect of the surrogacy can really bring a lot of those, you know, comments. But after I provided, they did the basic background checks, the financial aspect check, make sure I'm stable. Then there's a psychological exam. There's a very long psychological test that I had to do, and then sit with a psychologist to make sure that I'm not crazy to be focusing, trying to do this. And the intended parents also had to be cleared psychologically to make sure that they are ready for this complex journey to parenthood. And then during that time while we're doing this, they're also reviewing my medical records. Because remember, I told you I also was in this journey of infertility. So they had to verify that the infertility that I suffered was not female factor, because you don't want to invest in surrogacy. It's very expensive when it is the woman that has some issue of caring. So in my case, it was male factors. The IVF clinic, my OBGYN, my birth hospital provided all the documents to the IVF clinic for review. And then after I was cleared as a viable surrogate, then my profile was shown to the intended parents. So this agency in particular that I use is international. So 40% of the parents are international, they're not American, but usually 50, sometimes it goes to 40, 60. So they're shown my profile. So they have a picture of me, they have a picture of my family. What is Dama about? She is raising 2 children on her own. She is financially stable, but the most important part is the support system. So how is Damaris going to do this without affecting her life in a negative aspect? So there's all those, and sometimes they actually do an interview where you bring your family members and they ask them questions as well. For me, they didn't have to. I think my delivery of my, my life as it is was very clear. So they have to like your profile first. I think of it as dating. It was like dating. So these parents look at your profile, and then when they like you, the agency says, hey, Damaris, this couple from New Zealand like your profile, or this couple from this. When they do that, I'm like, oh, let me check their profile out. So they show me, they have to choose me first, and then I look at their profile. Then if I really connect with their story and I want to meet them, we meet via Zoom, and then we talk about all the things in the profile. For the surrogate, you have to be comfortable with things like, okay, if the embryo was implanted and it's split into 2, are you okay carrying the twins? If it's a yes, good. If it's a no, because there's always the chance of the embryo splitting in the IVF world, right? Or are you okay with having 1 embryo implanted at a time, or are you okay with 2 at a time for a higher chance of conception? So depending on your answers, then the matchmaker from the clinic matches you with the appropriate parents that are okay with your answers. Some people, for religious reasons, they will say, I want to be a surrogate, but I'm not okay with termination, so that kind of limits the matching. Are you COVID vaccinated? A lot of intended parents require that the surrogate be vaccinated. So I'm like, I am triple, I have all the 4 vaccines for COVID. And then they also do my titer to make sure that I have all the antibodies to protect the baby. You don't want to not have antibodies to chickenpox. And incidentally, while I was going through the screening, I found out that my 6th grade chickenpox antibodies had disappeared. So I had to do the vaccination over before getting medically cleared. So the medical clearance includes all of that. And then I also had to get my uterus checked. And this is where they instill some saline, and then they look at the anatomy of your uterus to make sure it would be appropriate to carry a child. And then also the thickness, in the IVF providers, they know how a uterus should look on different times of your cycle. So when I got the medical screening, then the next step is the legal. So now I was provided a list of attorneys, reproductive, they're called assisted reproduction attorneys. So I just had to pick, the intended parents cover 100% of all the steps of surrogacy. It is at no expense to me because we're working towards you becoming a parent. So all the medical clearance, my travel to California, the legal, they pay for all that. And it is required by law that the surrogate and the intended parents have separate attorneys because of conflict of interest, right? So the parents will have an attorney that will have their best interest at heart. But my attorney will be like, Damaris, this is what this contract says. It will give them power to make medical decisions for you. Let's change it to where it has to be a medical provider. And if we are in cahoots and we're not agreeing with a medical decision on the baby, then a third party, a third OBGYN needs to be involved to be the tiebreaker. So all of those things, my surrogacy contract is probably almost 100 pages long. It takes about 2 to 3 weeks of back and forth, but usually there's not too much of it because when you're getting matched, you've talked about the compensation package. You've talked about all the what ifs that would happen. Like literally, if you think of anything, for example, if my intended parents were in an accident and they both passed away, at no point will Dama be ever stuck with a baby that is not hers because of that contract. Because it is established even before the embryos are put in me that I have no parental rights. And the parents have to declare who would be the guardian in the event that they both died. So after the legal clearance, then the IVF cycle can begin. I started my progesterone shot, my estrogen, and they picked a local IVF clinic close to my house to do the monitoring so that I'm not flying to California each time. And then once, like it was go time, everything is good, my lining is translaminar, I went to California, and for me, I required that the embryos be genetically tested. The doctors, would be familiar with what I'm talking about, the PGF or PGA testing. And that way, I'm 40 years old now. I don't want a poor quality embryo to be implanted in me, and then I end up having a miscarriage. Then it doesn't look good on me as a surrogate, because I'm coming in with, oh, my oven is perfect, I just need to bake your cookies, right? So, but if your dough is not right, it's not going to be successful. So the genetic testing was done, and the best of the best was what was picked for implantation. And with the IVF cycle, 11 days from the day of implantation, the beta testing confirmed that I was pregnant, but I cheated. On day 6, I had already done a pregnancy test and it was already positive. So that's how it worked. And then I'm now 16 weeks. The intended parents were able to come with me to a couple of my OB appointments already. We keep in touch. A lot of people ask, so do you know them? Have you met them? Because it is very alien, this whole relationship, right? So the couple that I picked, I connected with them. We connected over different things like running and cooking and things. So you have conversations, the starting point. And then they're also 40 years old like me, both of them. Their families are very supportive and their core values really aligned with mine. Because these are people that I'm picking. And with my profile, I specified that out of this surrogacy relationship, what I would desire is a relationship with the family. I will never seek any maternal relationship with the baby, right? But I would appreciate updates on milestones. This human that I brought to the world, how are they doing when they go to kindergarten, on their birthdays and things like that? And that for them on their profile, that is what they want. They want to share as much as possible or as little as possible as the surrogate wants. So that's what I like about the surrogacy process here. The surrogate kind of has the authority to choose what she wants and agree to, because at the end of the day, it is their bodies that they are signing up to embark on this journey. And so with the deciding factor for where I'm going to have the baby, by law, a surrogate cannot travel out of state to have a baby for somebody else, because it borders on human trafficking, laws. So the surrogate location is where everything happens. I'm due January 27th. My induction is scheduled for January 22nd because my clinic, their protocol is all IVF babies. They prefer that they induce at 39 weeks if I don't go into labor before that, just for the safety. And then they monitor weekly for the amniotic fluid, just because it has been shown to have those risks versus naturally conceived babies. And of course, and there's extra monitoring for IVF babies as well. Like I will be having an echocardiogram on the baby's heart at the 24-week mark, just because they're more predisposed to congenital heart defects. But my OBGYN said all the ones that she's ever seen, it's never from IVF. It's always from genetic component. So that is the process. I appreciate the ability for me to balance it all and be able to gift a family what I enjoy every day. I have a 6-year-old and a 3-year-old. And I don't think any amount of money can quantify that joy of being a parent. And my line is always that your baby doesn't have to come through you. A lot of people think they can't love a child that hasn't come out of their bodies. I always say a child can come to you, through adoption. It doesn't have to come through you for you to love it the same. Yeah.
Okay.
So that is my surrogacy story. And I'll continue to share the good, the bad, and the ugly. I'm just thankful that so far everything for me has been smooth. And I only needed one transfer, where I know so many surrogates in my circle, in my agency, and even just on social media, people who are much younger and having to go through 2 or 3 IVF cycles for transferring before it takes. So I don't take it for granted that mine has been positive so far.
Thank you. I'm just exhausted by the whole story. For we who just tulifumba na kufumbua and got babies. I'm exhausted.
It's a sacrifice. It's a sacrifice that not many people think of unwilling, because just as with my own pregnancy, I had the risk of dying, right? I have the risk of a ruptured uterus. I have the risk of complications, gestational diabetes. And so when it comes to finding a surrogate, they are willing to go through that so that you can have what you desire. And so that's why not many people can be surrogates. Not many people can pass a psychological test of being able to recognize the difference between when you bond with your baby and when you're carrying somebody that's not yours, you know? And when people tell me, oh, won't you get attached to the baby? I laugh, because I'm like, if I gave you my daughter Shiloh to babysit all day, when I come to pick her up, Gioni, will you tell me, Dama, I really love your daughter, I think I want to keep her to be mine? You can't, because going into babysitting, you knew it's Dama's daughter, right? So for me, I say, I'm just carrying somebody else's baby. I can love it, I can care for it, but I don't have that maternal connection to the baby. I'm excited about all the milestones I'm meeting. I post my weekly updates, the bump updates, but it's still not mine. So for me as a surrogate, I love my intended parents. They have let me take the initiative on. They kind of, I sense that they always wait for Dama to suggest something. So what I did at this stage of my pregnancy, between 16 and 18 weeks, the baby's hearing will be fully developed, right? So I bought some earphones that are built just for babies, and it sticks to my belly, and there's an app. They can read books, they can talk to the baby, and I don't have to be listening in. I just put it on the baby and I chill. And the reason for that is that this baby knows my voice, right? This baby understands Dama's heartbeat, but then how can the baby bond with the parents? The best thing to do is to introduce them to the voices of the parents, because research has shown that even if you play lullabies when the baby is in the belly, after they are born, they recognize those sounds. So why don't we start the bonding at this time, so that by the time is hello world, they know the voices of the parents. So those are ways I support the bonding between the parents, because at the end of the day, it's my body, and they may feel like they are, you know, crossing boundaries when they ask things or when they do this. So I have to be letting them know what I'm comfortable with. When I go for my ultrasounds, I have them on their WhatsApp video so that they can be a part of it when they cannot be in town, so that they feel that at least the part that they can participate in bringing their miracle to life, they can take pride in that.
So 10, is this, okay, first of all, gestational surrogates exist in Kenya, right? Okay, Dama is shaking her head. So is that the legal route or the other route?
No, gestational surrogates do. We do have them in Kenya, and I'm just for the reasons that Damaris has said, and I just would love to applaud her. I think people would love you as a surrogate mother. You know, I think you should come here and offer your services. I mean, that's amazing. And you are very thorough with knowing what the process entails, and also your part in it, which is, I think, the most important part for a surrogate to understand. She's a babysitter, and therefore it's not my baby. I'm babysitting somebody's baby, and I will give the baby freely to their intended parents, because you have no genetic connection to that baby whatsoever.
Okay, so the lawyers step up now. Medics, you can lie uko pembeni sasa. Lawyers step up, it's your time to shine. Ayeta, are we playing God? And what are the ethics surrounding all these surrogacy issues? And if you could also, is it possible to go, that eugenics and gender and choosing the gender and all that, it's Zach's question, but just, if you could throw it in there.
Okay, Zach, first of all, yes, you've had The lady who is a surrogate said that she had a test done. There's a test called pre-implantation genetic testing. That is a group of tests. There's pre-implantation genetic screening and pre-implantation genetic diagnosis, which ideally is used to determine genetically linked diseases. However, fortunately or unfortunately, it actually gives you the gender, because most sex-linked diseases either follow the Y chromosome or the X chromosome. So that is the one way of ensuring that it is a baby boy or a baby girl. But is it legal? Now, that is a totally different question. Is it legal for social balancing, or is it just for medical reasons? That's totally a question for another day. There's also something nowadays that is called sperm sorting. There are sperm sorters, machines for sperm sorting. That is the one that people are going through, because when you do PGS and you try to implant, to transfer a baby that you have chosen, maybe boy, especially for Africans, we know most people, especially in Kenya, will choose the boy child. You've created embryos, perhaps you have 7 or 6 embryos, and you want to choose the boy child as opposed to the girl child, and then you'll have baby girls just there, not knowing where to take them. And as such, as lawyers, as the legals, we consider that as a form of infanticide, the one that used to happen, say, in India, where women would sleep on their baby girls, they die so that they can get pregnant again until when they get a boy. So that is just another form of an infanticide. So the ideal way right now, where people are doing so that it doesn't look like it's being infanticide in quotes, I'm doing quotes here, is doing sperm selection. Early, you do a sperm sorting where now you just choose the sperm that is ideally going to give you a boy child. That is the sperm that you're going to use to fertilize the egg and get a child, so that you can already implant or transfer the child that you have gotten. Now, back to surrogacy. So as you heard Dr. Wanjiro mention that there are 2 types. There's the traditional and the gestational. Traditional one, as she said, is where the person, the party who is providing, the woman who is carrying the baby, is also genetically linked to the child. How is this so? She's also the provider of the egg. That, unfortunately, it happens in a family setup, and unfortunately, it is not legal. Why am I saying it's not legally supported? This is because if you are going to provide an egg and at the same time carry the child, you are not only the biological mother, you're also the legal mother and the mother in all areas possible. So the only way to give up, I can't give, for instance, let me use Damaris and myself, for instance. If Damaris is going to carry a child for somebody else, she's gotten the egg from somebody else, the sperm, and they've been fertilized and put in her. That's a gestational surrogate. So she's not genetically linked to this child. So she is gestating for these people. And once she gives birth, she's going to give them to the couple. But if you're going to put sperm in me, for instance, Damaris' husband's sperm, and I gestate either through IUI or wherever form, and or we have sex, perhaps, as it used to happen in the olden days. This is biologically my child. This is legally my child in all areas possible. So law does not support this. That is why I'm saying it's a gentleman's agreement. That is why it used to happen in the olden society. We know the Kisses used to marry fellow women so that they can bear children for them, because they could not give birth. So they would sleep with their husbands and then give birth. But legally, you cannot take my child and give out my child who is biologically related to me, no matter how many agreements you have in place. The only way that could happen if as Leah will tell you, if it goes through an adoption process. So what is acceptable? Acceptable is the gestational surrogacy. And as Dr. Wanjiro has mentioned, some of the key reasons, we don't have a laureate, an assisted reproductive technology law per se, but we have a bill in Parliament, Assisted Reproductive Technology Bill of 2022, which we are currently just kind of doing the last final touches before we present it. It's presented finally again in Parliament so that it can be passed. And I can tell you it is very progressive as it is at the moment, because I've been very instrumental in it. I've been hands-on on it and stuff like that. So it's very progressive. It follows what Damaris has said, most of it, and a lot of things that seem to be a little bit foreign. So before I go into it, it seems a little bit foreign, but they are really things that we really need, because the surrogates themselves, we also want to ensure that once they've already carried, they don't go through trauma gestating for other people, so that once they have carried, they can also be able to carry for themselves later if they want to, or they can just continue with their lives. So What are the key requirements for someone to do a gestational surrogacy? We're not going to talk about traditional surrogacy because, as I've told you, the one is a gentleman's agreement. No magistrate is going to give out your child that you have carried, that you have used your own egg to somebody else unless it's through an adoption process. So what you're talking about is the gestational surrogate, where the surrogate, the person carrying, is not genetically related to the child. So you will have myself produce the egg, or an egg donor perhaps, and then a sperm from my husband, and then the fertilization will occur, and then the embryo will be implanted, say, in Damaris. You see, Damaris is not genetically related to that child. That is my child and my husband's child. That is gestational surrogate. So what are the requirements? You need to have a medical condition. The medical conditions that Dr. Wanjiru has stated are what we require for someone to undergo through gestational surrogacy. It's not a matter of, oh, I have a hot figure. Believe you me when I tell you I have a hot figure, it's just that I can't stand. But if I have a hot figure, I do not want to get pregnant and spoil my figure, or, oh, I'm too busy at work or stuff like that. No. Why we are saying this is because ethically, we do not want to put a woman through, ethically, we do not, we do not want to put a woman through pregnancy. Pregnancy, as you know, is something very complicated. It has issues, so you do not want to put a woman through that just for the sake for vanity purposes. The woman has to have a medical condition, and then there has to be a genetic link to one of the intended parents. The ideal situation is where both gametes are used from the intended parents. Say you get the egg from the woman herself and the sperm from the intended man, and fertilization occurs and the embryo is genetically linked to both of them. The next ideal situation is where we have a genetic link to at least one of the parents. So you either use an egg donor or a sperm donor. The non-existent one is egg donor, sperm donor, surrogate. That one, we are saying if we do that, you're just going to create extra. We are trying, fertility treatment is to treat infertility. So creating a child that is not genetically related to either of these parties is just creating extra problem, because as you know, we already have too many children that need to be adopted. This is a child who's not genetically related to anybody. So why not just go to the adoption home, to the children's home, and adopt a child who is not genetically related to you? And number two, how are you going to enforce even parentage and stuff like that? Because one of the key things to enforce parentage legally is through DNA testing. If you test this child is not genetically linked to either of the parents, so you cannot enforce that. So medical condition is key, genetic link to at least one of the intended parents, and then there has to be an agreement in writing in Kenya detailing the process, who's responsible for what, ABC. As Damaris said, it's usually the intended parents who are responsible for all financial obligations, be it legal obligations, be it medical obligations, be it what. But even in the agreement, if Damaris will tell you, she also has a part she plays where there's details on what she's supposed to do, how she's supposed to do ABCD, even the fertility center, what they're entitled to, how many embryos can they implant, can they transfer, and stuff like that, if she's able to carry one or two and stuff like that. So once those have been met, then you proceed, and ideally you have to do the legal consults first, because this is third-party treatment. You are involving another party into the treatment that is not essentially a party to this is bedroom matters per se. So you're involving a third party that is not essentially part of the program. So you have to have all the legal documentation in place first, because anybody can sue you. Putting an embryo in somebody who has not consented, that's already, undergoing, I don't even know what to say. You're already assaulting this person and many other probabilities. So every step of the way, and as you know, in Kenya, in our context in Kenya, fertility treatment of infertility is not considered as primary care. It's not even secondary care. It's actually, grouped with things like cosmetic surgery, tertiary care, and stuff like that. So for you to undergo any fertility treatment, be it even at the IVF, even if you're going to carry your own child, you must agree to it, consent every step of the way. Okay, can we inject you? Can we do can we do tests to determine that your womb is okay? Yes, consent. Can we inject you so that we get eggs from you? Yes. Can we aspirate the eggs, get the eggs? Yes. Can we fertilize? Because you can take the eggs and the person decides, I do not want them to be fertilized. Can we fertilize with so-and-so sperm? Yes. Can you transfer the eggs to you, especially as a third party, as a surrogate? Yes. Are you willing for the embryo to be, more than one? Yes, and stuff like that. So all the legal assertions have to be in place. However, before we even get there are key requirements that a surrogate has to possess to be legally eligible to be a surrogate. Number one, she has to be 25 years and above. Why 25? It's just a magic number. It's not a magic number or something like that. It's a number that was arrived at because this woman has to also have had a child of her own. As I said before, you're not going to put a woman through pregnancy for the sake of another party, yet this is a person that might want to get pregnant later. We all know pregnancy. People have died while giving birth or have lost wombs while giving birth. So what if this happens to this girl or this woman, and then she gets that, and then she becomes a patient? You do not use a woman as a means to an end to another party unless it is a key requirement. So she must be 25 years and above. Another reason why she has to be 25 years and above is because mentally and psychologically, she has to be able to go through the pregnancy process. As Damaris pointed out, they're supposed to be psychologically screened. Surrogacy is not something that you just wake up tomorrow and decide, okay, I'm going to carry a pregnancy for somebody. It is mind-blogging, tiring, and all that. So they have to be psychologically screened and then passed and then counseled by the psychologist, and a report has to be generated. This is a report that will be used even in court when I get to that part for transference of parentage from one party to the other party. And then another thing is, of course, they have to be medically screened, criminally screened, because some of these people, you don't know them. If you're bringing your sister, you know her. If you're bringing Damaris, who I've just met today and has given me some terminology, hardcore babysitting, then clearly I have to take her through criminal screening. I do not know her from Adam, so I do not know if she's going to run away with my child or something like that. So they have to go through that. And they must have a child of their own. Ideally, this child has to be 3 years and above so that the child has already finished breastfeeding, finished needing mother care and stuff like that. The child can be less than 3 years old, but we say ideally the child has to be 3 years and above. So once she has met all those requirements and the intended parents have met the requirements of being medically cleared for surrogacy and having a genetic link, is when now they can hook up and then the process can start. Once that has finished and a pregnancy has been achieved and a child has been born, how do you go about registering the child? At the moment, I have said we do not have concrete laws. But when I say concrete laws, I'm not saying that we are just in a vacuum. No, we have a Children Act, we have the Constitution, we have essentially other laws that come into play, transferring parentage from one party that did not give birth to a party that gave birth. Because as you can see, when it comes to surrogacy, there can be two parents, two mothers, or even three mothers legally. There's the biological mother. It can be the biological mother can be the intended mother, or in some instances, a gamete donor, an egg donor, if the thing went through, they had to use an egg donor. We have a legal mother. The legal mother is the mother who signs the documentation that they are going through the surrogacy program. She may or may not be the biological mother of the child because maybe a donor has been used. And then we have the birth mother. The birth mother is, of course, the surrogate, the person who brings forth the child. So we are in a situation where we may have three mothers or ideally two mothers. And now you want this mother just to be one. The legal mother is the one that matters. So at the moment, we have two processes at the Children's Court, but it has quammed a little bit. I don't know what English word for quamming at the moment is. It's Sunday, so pardon my Swahili here and there. So it has quammed a little bit, and what people are doing, because what people are doing is kinship adoption. Leah will talk about kinship adoption more. Where you adopt a person who is genetically related to you. As you can see, DNA will come into play. But the bill that you're working on right now has a provision for parental order. Parental order is once these elements have been checked and they've been seen that the parties underwent psychological counseling, there was a medical condition, all those elements that I have cited, and they are before court, and they proceed and bring DNA to show that there's a genetic link to the intended parent, either both of them or one of them, then they'll be given a parental order to transfer parental rights, all rights, because when you bring forth a child, of course, you come with rights and responsibilities as the birth mother. So they want to transfer all these rights, the birth mother's rights, to their legal parents' rights. And then the most important bit, of course, issue a birth certificate to the intended parents. Because in Kenya, Damaris, I don't know if you gave birth in Kenya or abroad, your first two kids, as you said. In Kenya, you use the birth notification to get a birth certificate. And if the birth mother is the surrogate, let's still use Damaris. If the birth mother is the surrogate and it's Damaris, then the birth notification will read Damaris because she's the birth mother. A birth notification is a notice to anybody who cares to read or listen or learn that somebody gave birth. So if it's Damaris, then if you're going to write Ruby, you see that's already an idea or a way of child trafficking because it's a slippery slope. Kesho, nitachukua mtoto wangu, I will get my child and I will look for a rich family and tell them, I give birth to hot babies, by the way. So why don't you just give me some 20 million, we will go to the hospital, the birth notification will be written in your name. So for it to have, to be open and all that, there has to be a legal process to transfer the parentage from one party to the other party. We want to make it as legal as possible without being complicated. Because at the moment, I can tell you for a fact, it is a little bit complicated. You go to children's court, they toss you back and forth, back and forth. You go to the high court, they'll tell you to do kinship adoption. And it is just double trauma for you to give birth, to have your child born. You have to have treatment, infertility treatment. And then once you give, your child has been born, you also have to go through the adoption process to your child. So we are trying to, the parental order will take care of this. But before then, I must admit that there are some complications in child registration, and that is something that should be taken and looked into. So what are some of the ethical issues? A lot in Kenya is, especially to the surrogates themselves, is the abuse that the surrogates are getting. You find people wanting to give the surrogates very little money. There's a lot of, especially from if they're dealing through agencies and stuff like that. That is why I always encourage surrogates to deal directly with the fertility practitioner, the clinic itself. You find that they want to give them even $300,000. I don't know if that is around $3,000. I think that is just signing bonus for people in America. It's not even anything else. It's not even signing bonus. I think signing bonus is $5,000. So there's a lot of abuse and misuse of surrogates because these are girls who are mostly house girls, watch ladies, wasichana wa supermarket and stuff like that. So people assume that they get so little anyway, so why not just they give them some token here and there, and they do not take their work as serious as possible. And then another thing also is some of these people, you'll find that they want, how they used to do it in India, they want to put them in homes, and it's like a breeding pen where you put 6 or 7 surrogates together and wafungie, you cannot go out, you cannot see people, you cannot wherever, you have to do this, you have to do this, you have to do this, until they don't have the rights. Their rights are literally taken away from them. And because they're so desperate to go through the process, they will literally give up their rights just to go through the process. And some agencies, once you even give birth, they don't even give you your monies, or perhaps they negotiated 700,000 for you, that's 7,000. And at the end of the day, they take 50% and give you half. So those are the things that we are trying to look into in the new bill. And I hope once it passes that some of these situations are going to be rectified. So at the moment, that's all I have. Perhaps we will just continue progressing to discuss as we progress. Thank you.
Thank you. And I just want, Damaris, I think this would be for you. How has the Kim Kardashian, you know what I mean? Kim Kardashian and the whole surrogacy, the celebrity surrogacy, and the very many abortion laws, how have they affected surrogacy according as far as you know?
For me, like with the, for example, the John Legend's wife, as you all know, Chrissy Teigen, she has gone through multiple IVF cycles after so many miscarriages. And last year, when she lost her son Jack, and she started venturing into surrogacy, but then last minute she decided, you know what, let me try to carry one more time. When she carried, it worked, and and yet the surrogacy process was already ongoing. So at some point she was pregnant alongside her surrogate. And of course, the media, there's always going to be people who will be, oh, they're rich, that's why they went through surrogacy, that they have money. Khloe Kardashian, when she recently, a few of the recent episodes where she's talked about how she resented the baby because when they were doing the surrogacy process, her fiance at the time cheated on her, right? So her anger was kind of misplaced. And then with the added layer of you don't have the bonding you would if you're carrying your own baby, somebody else carrying a baby that is yours and the man that has, you know, scorned you. So with that, it really gave surrogacy a bad rap, like the last few months. But what people don't recognize is that there is the contract at the end of the day. You know, the contract agreement did not say, oh, if I break up with my husband, then I'm not going to want the surrogacy. Or, you know, so with that, most of it, when I read it, being a surrogate, a lot of the reactions are emotional. They're emotional reactions. Nobody really focuses on, oh, what happens before they even get to this step. There's all the factual, medical, legal components of it before we actually get to where, oh, the surrogate is pregnant with another, caring for somebody. And so usually I take such comments with a grain of salt because we don't know the background of these people. Recently, somebody sent me a CNN link on, I think it was Atlanta. This surrogate decided she was going to decline medically necessary termination. And the reason for that was she had 2 embryos implanted and both took but one split. So now she has triplets. And in the medical world, we know triplets can survive, but then there is the risk. And when you're talking about an intended parent who has spent hundreds of thousands of dollars trying to get where they are, the risk of losing all 3, you know, medically, they were recommending a reduction. And that's why I just responded to somebody in the chat about, you know, what if the surrogate doesn't want to do this? So with that one, it was a medically necessary reduction, but now the surrogate has refused. And the law protects the surrogate as well. It's still her body, right? So, but it's a breach of contract. So yeah, she can carry the 3 kids, but the law can actually make it to where for the life of that child, whether they have medical reasons or not, she's responsible financially because it's a breach of contract. There are so many things that are unknown in that news clip that was sent because we don't know what the details are in the contract. But I live in Texas, and a lot of intended parents really run away from any surrogates from Texas because our governor is totally, the laws are so archaic. I, as a healthcare provider, I'm a nurse, I have seen firsthand people who have ended up passing away with sepsis because they're coming in, the fetus is not viable, but they cannot do a D&C because they feel a heartbeat. Oh, the baby still has a 20 heartbeat per minute, but this is a 15-week pregnancy. It's not going to survive. And many mothers, and it's actually 2 weeks ago, there was a big court hearing in Austin, Texas, and there was all these women sharing their experiences during the Roe v. Wade reversal last year. Many, many women died of sepsis and other complications because of that law. So for me, my intended parents, they're international, so they're not as emotionally connected to our politics as much. And they're from Finland, where the laws are, yes, very established. But so, and with the contract, we have to discuss the demerits. If there's a medically necessary termination, and Texas doesn't allow any doctor to help you, like you literally have to be dying or facing death or dead, what are you okay with? And for me, I'm okay traveling to California to get the medically needed care for myself in order to protect my life and protect the babies, you know, if it is something that is for the baby, because ultimately in Texas, they really won't care. Texas has at this point the highest mortality rate for mothers. It is very unfortunate. So when you add that surrogacy component, it makes it so much harder, because now the deciding factor is not just you. There is the legal parents, the biological parents, and Ayeka mentioned the registration. Interestingly, my parents are from Finland, and the registration up until last year, when the baby is born, I would have had to actually have my name on the birth certificate, because in Finland they did not recognize the difference between a birth mother and a biological mother. If it came out of your vagina, you are the mother. Is pretty much how the law stated it. But it has gone through a lot of constitutional review and changes. So now I literally don't even have to appear on the birth certificate. So because the law recognizes that I'm a surrogate, and they don't have to do any parentage transfer after the baby is born. So same thing with California, very established. So like I mentioned, Louisiana is one of those states that is very, very still backward. They still have to transfer parentage, which is pretty much adoption, to have your own baby.
And my other question, and anyway, I think Ayeta or Wanjiru can answer this. If you have a surrogate like Damaris, who's very switched on, and my cousin's nephew's auntie's child in Eshibinga, who's, as in the informational discrepancy is a bit much. How is that where the new law is gonna step in and advocate for my Eshibinga villager? Because Damaris is switched on, she knows what she wants, and she knows what needs to be done. Is the law supposed to help my cousin's neighbor's aunt?
Before Dr. Wanjiru answers, let me just say something. Yes, the law is trying to harmonize everything so that it doesn't matter if your cousin from Eshibinga or some enlightened Damaris wannabe from Nairobi is the one doing the carriage. So they are laying down very, very specific requirements. You have to meet this, you have to meet this, you have to meet this. At some point when we actually started writing out the law, one of the key requirements that we had actually put in is the party has to have finished Form 4, for informed consent, for them to understand, for them to be able to give informed consent, to understand what they're going through. We had even indicated that they must be like college dropouts or college-going girls and stuff like that. But as usual, our parliamentarians said, no, all you need is a womb. What has education got to do with somebody carrying a pregnancy? So to just kind of deal with that, we just have tried to put in very many requirements, like be 25 years and above, go for psychological analysis. That is one of the key requirements, because now the psychologist will be able to say this one understands. Because I have gone through some of these processes. You take a girl through the agreement, you tell her everything that will be required, you give her all information and all that, and then just before she signs, she asks you in Swahili, so nitalala na mzee siku gani? As in, she has literally not understood what you are taking her through, and you are in the process of signing the agreement. You think you've gone through everything and all that, but she asks you, when am I sleeping with the man? Like, she doesn't even understand. So some of these things, because initially people used to bring their house girls, standard 8 dropouts and stuff like that, people who do not understand this. So that is where the law comes into play, where we are trying to harmonize all the requirements so that the parties who are going to, I have seen people who bring their sisters, or people who are, there was this case, my favorite actually, where a lawyer girl, she's a lawyer, her surrogate was her sister who is a doctor, and it was amazing because they were all at par, they understood everything, and it was really good. So if we get, at the moment, I can't say that we've gotten to that stage, but if we get to a stage where the surrogates themselves can even advocate for themselves, that would be amazing. But what most fertility doctors are doing at the moment is using agents who are kind of sitting on these surrogates. The agents are the ones who are literally making decisions and choices for these surrogates. So the surrogate may not even know. For instance, there are surrogates who don't even know that they're carrying a multiple pregnancy until when they're giving birth, is when the doctor is like, okay, mtoto moja ametoka now, let's wait for the other one. And they're like, wait a minute, I didn't know I had twins and stuff like that. So once the law goes into place, then at least some of these issues may be checked into. So yeah.
And I guess to add to your point with the surrogates and being abused and taken advantage of, I've had, as I share my journey through Facebook, and I've had people ask if they can travel to Kenya to do surrogacy. And for me, with my passion and knowing our Kenyans, I always tell them, if the agency is not allowing you to have a direct relationship with the surrogate, you need to run. You need to run, because you have to have that direct connection with the surrogate. If you're being blocked, it means they're being taken advantage of. There's no way they can block you if they're being fair and equitable to that surrogate, because whatever they're negotiating, and I know, like it can go up to, I know somebody who had to pay 3 million Kenyan shillings for the surrogacy, but she worked directly with the surrogate. So with the agencies, if that is what they're commanding, and I just recently found a surrogate agency in Kenya where they were asking for $65,000 as a down payment. And for me, I thought that was mind blowing. I'm gonna need to read a little more on this, because then it is easier for these Kenyan families to come to America then and do surrogacy if the cost is the same and they're legally protected in every aspect. Mm-hmm. Yeah, so it's unfortunate, but we do have a long way to go. And what I wanted to add on the requirements that you also mentioned is that I not only have to have at least one child of my own, I have to have primary custody. So me being divorced, if my ex-husband was the one that was the primary custodian, I don't qualify to be a surrogate. I have to be the one raising my own children. And they prefer that you have already completed building your family, because as we know, with birth, if your uterus ruptures, there's complications and your uterus has to be removed, then you won't be able to raise, to have more children. So as a surrogate, you have to be prepared that this might be the last pregnancy. So do you have your kiddos that you want, or one or two, before you embark on the journey, or you would rather wait until umezaa yako and then you can do that for somebody else?
Just a quick one.
And also, Ayeta, as you add on, you say the surrogate must be above 25. What's a cut off until it's 25 to?
The bill says to 35 years, but initially we would allow as old as 40 years. Apparently, I'm informed the uterus does not get old. I'm not a doctor, so I don't know that. Ideally, it used to be a 40. Yeah. But the bill allows, yeah, the bill allows
about the same.
The bill allows up to 35 years. And then another thing that the bill has, just to add on what Damaris is talking about, uterus rupturing and all that, what the bill is also has put into place is the issue of insurance. In Kenya, most people don't have health insurance, especially these surrogates. So when they get into this issue, it's just a matter of a gentleman's agreement that I will carry, if something happens to me, unfortunately, there's nobody to take care of my children, my health insurance will not be guaranteed and stuff like that, because the agreement, which is not enforceable, it is actually persuasive. It is just used as a persuasive tool to ensure that everyone understands that this is what is going on, but you cannot sue the person on the agreement per se. So it's just a persuasive tool and not enforceable, because we followed the UK system. Even the UK, the agreement is not enforceable. So it's just a persuasive tool. So what we have also tried to put in the bill is the issue of health insurance. Before you even start surrogacy at the moment, what will be happening is you must get a health insurance for the surrogate, as well as life insurance. When Damaris mentioned rupturing, I realized that people can even die during the whole process and stuff like that, so that the surrogate's children are taken care of after and beyond. But that is something that has not come into play at the moment. We don't have health insurance for the surrogate unless she decides to use her NHIF, which in most cases, they don't even have the NHIF to start with.
Well, I want to interject and say that is happening right now. I think it's being painted as a very bad picture, but surrogacy does happen. And I think the fact of the ladies being educated, we are actually having more educated surrogates coming up. I mean, they're teachers, they're nurses, they're patient attendants, people who are actually in the medical practice, also wanting to carry. But I think the best, as Ayeta had said, is a sister or a close family member, because they tend to be very educated, very switched on, and want to do the best for you. So I wouldn't say there's a lot of that. I think maybe international patients who don't know their way around, but for our local patients, a lot of them have surrogates who are actually very switched on and know what is going on. And the legal process, as I said, I mean, Ayeta does a lot of the contracts for us, and therefore, I mean, it's very clear what you are going into before you get into, for both parties. About insurance, we now are trying to ask our patients to take insurance for their surrogates, and the only drawback sometimes is that they have to then wait 1 year for the pregnancy insurance to lapse 1 year, so that then they can have antenatal care. But it is, I mean, some of the patients are agreeing, but a lot of patients will genuinely pay for the surrogate without any issues. Yeah, because they already know that the possible cost.
Okay, Damaris, are you able to voice what you've just typed in, so that the people on Facebook who don't see the Zoom chat can get that?
Touching on the insurance, I work for a company that provides me good insurance, but it does not cover a surrogacy pregnancy, because it's not my pregnancy. So what my intended parents had to do, they had to start a policy. They had to take up a policy for me, and the open enrollment window was for this year. It was starting in February. The next one is in November. So much as I was not pregnant in February, they had to start paying my monthly premiums for my insurance. And that way, by the time we went for the embryo transfer, I was already covered. And yet, in the contract, the surrogacy contract, and in the compensation package, it included discussion for life insurance. Everybody knows that pregnancy, there's a risk of loss of life. And what happens then? So they have an insurance policy that they pay for that actually will have to stay active until a year after I have the baby, because we all know complications can happen that can drag on. If I have a C-section, what happens? So all of those things, it not only in terms of compensation, but what happens in case this. So it's so many what if everything is discussed. So with the life insurance, for sure, my children are listed as my beneficiaries in the event of my passing. The contract also handles things like, there's so many road accidents every day, right? What happens if Damaris is in an accident and she's brain dead and she's pregnant? What is the legal component? Damaris, what are you okay with? Are you okay with being placed on life support until this fetus is viable enough to be taken out via C-section before you are let to pass on? So those are hard discussions that people do not think about. So that if I'm 20 weeks pregnant and I'm in a wreck and I'm brain dead, the parents, if I've said I'm okay with being put on life support to keep your baby growing until 23 weeks, where in America here it's viable, right? But they try to keep it to 25. Then they do the C-section, and then my family can make the decision. And usually my family doesn't even have to make the decision. By the 28th week, I will already have made my advance directive and my will, what I would like in the case, which we all should be having anyway, without even the complexities of surrogacy. We should already have a game plan on what happens if this happens. So in that regard, the cost will still land on the intended parents. The cost of keeping me alive for that duration of time would be on them. And then, of course, the life insurance that they have on me, and then the life insurance that I have for myself, any policy packages that I have would be to my beneficiaries. But at the end of the day, that contract still, what people never think of, it talks about in the event that you die, or you're in a situation where the baby's still alive, but you are brain dead. Yeah, so.
Surrogate children are really wanted children. Okay.
Exactly, they are.
as the questions, as you gather your questions, let's just move to the next lawyer. Let's talk about adoption. As people, if you can bring your questions. Just take us through the adoption process, Kenyan style. Start from wherever you want to. Kizungu, bado iko huko. I'm just thinking of this surrogate journey. Nimechoka kichwa.
All right. Okay, so how adoption works in Kenya is that it's sort of a three-step process. So the first step is you need to work with a registered adoption society. The government, through the Children's Department, registers adoption societies on an annual basis. So you need to work with a registered adoption society. And what the adoption society does is that it assesses you and finds you fit for adoption. And then it also, what the adoption society will do next is place you with a child who has been declared free for adoption. And then once that happens, the law is that you stay with that child for 3 months, and then you start the court process. So there is the pre-approval, and then there is, the bonding time of 3 months, and then now you can go on and start the court process. And then the court process ends with a court order. Then you can get an adoption certificate and a post-adoption birth certificate. We didn't always have a post-adoption birth certificate. People now take it for granted, and everybody says, when do I get the birth certificate? But for the longest time, we didn't have it. I think it took a court decision. It's actually not in the statutes even now. Even the New Children Act did not talk about it. But it was a high court decision where the judge said, it's discriminatory for kids not to have a birth certificate after they've been adopted. So there'll be a post-adoption birth certificate which lists the parents who've adopted as the parents of the child. And I usually say once that is done, if you want to apply for a passport still, because it's government, you would think that, you just rock up with your birth certificate because you finished the process. But I find that if you do that, then, Nyayo House immediately flags your birth certificate, tells you it's fake, etc., etc., unless you show up with your adoption certificate as well as your adoption order, together with that post-adoption birth certificate. So that's basically the process in a nutshell. I think the relationship with surrogacy is like the situation that Damaris has talked about, that is the position in Louisiana, because in Kenya, the birth mother is the mother who has given birth to the child. And so if you want to, once that happens, then, and you're Kenyans, you have to go through an adoption process, what Ayeta is calling kinship adoption, because the child will be already related to one of you. Assuming the child is already related to one of you, then you have to go through an adoption court process. But what I've understood also from talking to Ayeta is that for people who are not Kenyans, like when internationals come to Kenya to do the process, the surrogacy process, they just need to go to the lower court, the children's court, and ask for orders saying their parents, because their countries recognize the surrogate parents as the parents. So if you're from a country where the surrogate parent is recognized as the parent, then I think the lower court, the children's court, gives you the parental order, then you just go to your embassy, and your embassy knows, oh, this is surrogacy, we recognize you, and they'll give you birth certificates or whatever documents that you need to travel. But for Kenyans in Kenya, and I guess, somebody in Louisiana, I don't know what's the situation in other countries, you have to go through the adoption process. And the difficulty is now that you now have to go through the same process of, going through the adoption society, for the adoption society to assess you and find you fit for adoption, also declare the child free for adoption. The only thing that, of course, will not be required is for the 3-month process, because you're obviously already bonded to the child, through the bonds of biology, through the agreement that you have had with a surrogate agreement. But otherwise, you go through the same process as everybody else. So it's been very interesting, because most people say, oh, why should I adopt my own child? And there's a lot of objection to that. I guess once the bill passes, it will take care of that. But another situation where people adopt their own child is when you are adopting your spouse's child. If you're adopting your spouse's child, you've gotten married and your spouse wants to adopt your child so that your child can have the same status as the biological children in the family. You still go through an adoption process. And the adoption process is, it's the same. You get assessed, the child is declared free for adoption. So I always ask people in such a situation, are you sitting? Because as I give you what is required, because you will have to be assessed, and you're like, I'm being assessed for my own child. And the reason is because in law, if you give up your child to your spouse, you've given up the child to the spouse. So the spouse becomes the parent of the child. So if you want to remain on the birth certificate, the eventual birth certificate, it means both of you have to adopt, and so that the documents can come out in the end with both your names. Otherwise, if you give up your child to your spouse for adoption, it means that you're giving them up to have sole parental responsibility and legal rights over the child. And so so for surrogates who are for parents who are using a surrogate and they are Kenyans, they still have to go through the adoption process. And so let me say something also about POSA, about the difference that it's going to make. Damaris, you said something that triggered a thought in my mind. You said that if the parents do not have, if the agency doesn't allow the surrogate to have a relationship with the parents, that then you should run. And that made me think about how in Kenya we don't have, except in kinship adoptions, where you're adopting your cousin's child or your spouse's child or your sister's child, we don't have that private adoption, so to speak, or open adoption, where if the child is given up for adoption, you know the parents they are going to. So how it works in Kenya is, if you want to give up your child for adoption, you give up your child to the adoption agency. Then the adoption agency, will help in terms of getting the paperwork that will make sure the child is, confirm that the child is free for adoption. You have 6 weeks after the child is born to change your mind. You can come back and for the child. And so, but then we don't have that. We don't have private adoptions or open. I think the right word is open adoptions. We don't have open adoptions where I'm pregnant and then I say, I want to give my child up to POSA, and unless it's a family adoption. Otherwise, the process is that it's a closed and public adoption, where the mother gives up the child to an adoption society and they don't know who it is who will be eventually placed with the child. So the only people with the privilege of choosing who will be the parents of the child that they're adopting, according to our law right now, is if you're doing an adoption within the family.
Interesting. Yeah, because I'm so used to, seeing adoption here in America. If it's a teenage mom, they interview potential parents, like, will you be good for my kid? Am I, all of that. And then even with that, the decision is, are you okay with not having any contact? They can, when they sign off, you don't go looking for this child. They won't update you on anything. And then of course the open one is where some people even have play dates, because these people that give up their kids for adoption, sometimes they move on and they're stable in their lives later, get married and start a family. And then they still keep in touch with their children that they put up for adoption, or they just never know and they just have to wait. And that is where there's that saving grace aspect of genetic testing, 23andMe and Ancestry.com, where now kids that knew or suspected they were adopted, because some parents don't reveal to their own children that they were adopted. And the children have to find out the hard way. And it is traumatic for a lot of people when they're just doing the 23andMe testing because it was a Christmas gift, only to discover, wait a minute, it says I have a brother in California. It says I have how, and then that's when those conversations come up. And then after that, of course, they can seek the relationship with the birth parents. Yeah.
I think my state just opened up all the previously closed adoptions in the state of Minnesota are going to open up, I think, next week. So even if I had a Kajifichini baby, my children are going to go. It's going to be acrimonious, but we'll be here. I will update you guys. And Lem, my question is, can anyone adopt, as in, okay, or does it have to be, can single people adopt, or it's only heterosexual couples who can legally adopt in Kenya?
Okay, so you in Kenya, you have to be between the age of 25 and 65. If you're over 65, you have to show their special circumstances, which, and usually, like kinship, for kinship, they said for kinship, you don't have to establish special circumstances. So if it's you're adopting your grandchild, which usually happens, you don't have to show special circumstances. But if you're over 65 and you're adopting a child from an institution, then you have to show special circumstances. So you have to be between 25 and 65. And then if you are adopting as two people, you have to be married. And because we currently don't have gay marriage, the assumption is that you can't adopt if you have a gay marriage. The most interesting thing is that the old act, the Children's Act, we have a new Children's Act, 2022 Act. So the old act said homosexuals could not adopt, but the new act doesn't. It doesn't make that reference. And so I had a webinar with judges and adoption societies, and I was asking them, so will you guys be will you be approving people who admit that they are gay? And then the adoption societies were queasy. The judges were outright said, is homosexuality a crime in Kenya? It is a crime, and therefore you can't be a criminal if you want to adopt, because the one of the things that the law says is it sets out a list of offenses which you can't adopt if you have been convicted of that offense. And my view was, it's very rare that people are convicted. Or the offense exists in law, but how many times are people convicted? So how will you be able to know? Because everybody has, if you've not been convicted, then you'll have a certificate of good conduct from the police. So it's going to be interesting. I wonder if it was by design that the prohibition was removed, or is it by default? And then something else that happened last year is that when the acts changed, it says it used to be that single women could only adopt boys if there are special circumstances, and single men could only adopt girls if there are special circumstances, but they could adopt boys without establishing special circumstances. But now what the law removes that special circumstances requirement, so single women can adopt. If you're single, you can adopt either a boy or a girl. And but for men, what they did, and I'm so sure this is going to go to court, and the Constitutional Court will say this is discriminatory. They said that for men, you can only adopt your relatives. So whether it's a girl or a boy, men can't adopt unless they're adopting single men can't adopt unless they're adopting their relative, and that's the new law.
Okay. This is just me going back to surrogacy and piggybacking on what is it called, adoption. So 10, the surrogacy in Kenya, are you implanting other people's embryos? Like you're not genetically, not I don't know, like okay, so me and my husband cannot get a child. Then you had an IVF cycle, and then you froze some embryos which are Wanjiro and Jogona's child. But I want to carry a child because labor and childbirth is a thing in my culture. I have to prove my worth. And then so the embryo gets implanted in me. I'm not related to that child. I'm not giving out that child, but it's gonna be my child. Is that kind of surrogacy happening in Kenya?
So that is not surrogacy again, because surrogacy is when these intended parents have actually given out their baby to, have given their baby and will get their baby back. That's gamete donation or embryo donation. So what that means, that's embryo. So an embryo has been created, say a couple has come, we've done an IVF cycle, they've got excess embryos. Maybe they come, they have twins, then the next cycle they have one child, and then now maybe they have 8 embryos left, and they're like, we don't want these embryos anymore. That is, so they would donate to somebody else who needs embryos and who cannot deliver or something like that. in my center, we don't do embryo donation, and that's just, there are no laws. So ethically, I think for us, we have to decide what are our ethics and what does that mean to us. So my center does not do embryo donation just because of the ethics around it. But I know of other centers that will do embryo donation.
In Kenya?
Yes, in Kenya.
Oh, okay. So in that case, Leah, who, because does that child get adopted? What happens? Or because they came, as Damaris rightly said, they came from your vagina, they're your child. So because the birth notification will show I gave birth, but that child is not mine in any way, shape, or form. Do I adopt that child, or what happens?
You don't need to, because the Lord recognizes that child as your child because they came from
My vagina.
Or through you, yeah, and they came through you. Damaris, I just love your lingo because you've done the research. I mean, it just sounds, yeah. So because the child came through you, it's your child. You don't need to do anything, actually. And I guess if anything arose, if a problem arose, then maybe the contracts, as you know, as Ayeta was referring to as gentleman's agreement. Then those contracts, even though if the person who donated comes to ask for, you know, what they consider their child. I was actually once involved in a custody battle of this nature, and it was very, very uncomfortable because what had happened is that, you know, the child was a family, and the parents were you know, there was going to be a breakup, and they needed to decide on the custody. And there was the issue of, you know, the child is young, the children of tender years stay with the mom. But, you know, the dad would keep reminding her that this is not your child. You just gave birth to the child. The sperm was mine, the egg was somebody else's. If I'm using the correct terminology, 10, as a lay person. Yeah, and he kept reminding her. I mean, in lawyers, we are not gonna put it out there, but you and I know. But they don't need to adopt because the law recognizes that this is the court recognizes the woman giving birth as the mother of the child.
If I may just jump in, Posa, when you're doing gamete donation, be it sperm or egg, whoever receives the gamete is as good as the biological parent. So if I'm going to sire a child by use of an egg donor, basically because maybe I do not have my own eggs and we use my husband's sperm, so that is ideally my child, even in matters in the laws surrounding organ donation and stuff like that. That is, it's just the same as if I give you my kidney. We cannot go to court and start arguing whose kidney is it, whose wherever it is. That is essentially an organ that has been donated to me, and it is my child. So when the child comes out from my vagina, that is why we have a birth mother, separate from a legal mother, separate from a biological mother. So when the child comes from my vagina, then it is essentially my child. For me to give out that child, then it has to go through an adoption process, but it is my child, and I have all the rights and responsibilities towards it. That is why Leah is saying that case of where the child was born and it was born through a gamete donor and stuff like that. The woman who received the eggs is essentially the mother. So there is no court that can take away that child from her, because once she signs that she's getting a child through an egg donor, then that is her child. So gamete donation is something that is acceptable, not just in Kenya, but worldwide. It is used all over. So whoever gets the gamete, be it a sperm or wherever, that is their child. They are not going to go through legal process to get the child or stuff like that. Once the child is born, the birth notification will come out in the party who bore the child, and the birth certificate will actually be generated using that birth notification towards the people who bore the child. It is different from what you asked Dr. Ndegwa about embryo donation. When it comes to embryo donation, yes, there are clinics that are doing embryo donation. I know some myself. When it's not egg donation, embryo donation. So when it comes to embryo donation, the party that receives the embryo as you, Posa, and your husband or partner, you are the parents of the child. It's not any other party. However, embryo donation cannot be done to a surrogate birth, because remember when I said the key legal requirements for a surrogacy, one of them is there has to be a genetic link to either of the intended parties. Now, this is an embryo donation, an embryo that has been created by Ruby's eggs and my husband's sperm and given to Damaris. So you see, there's no genetic link and stuff like that. So it has to have a genetic link. So you as a party, if you're going to give birth to this child and all that, and you're going to take care of the child, yes, you can receive embryo donation. But if you're going to get this embryo donation and also use it to another party to carry it as a surrogate, then that's not acceptable. You see that is not even third party reproduction. That's already fourth party reproduction, because they're the people who created the embryos, there's the surrogate, and there's you who's receiving the embryo. So embryo donation to you as a patient, yes. Embryo donation to be used as a surrogate birth, no, that's not acceptable because there's no genetic link whatsoever. I hope that's a little bit clear.
And so for the bioethics bit, this embryo donation and all that stuff, in future, to reduce the instances of consanguineous unions.
Yeah.
Okay, you might need to, yeah, as in marriage between related people. Are we gonna be telling these future embryos that they need to do genetic testing before they step into union, or will just go in blindly?
Even before genetic testing, what the bill has come up with is an information database where every donation and wherever, not just embryo donation, even gamete donation, eggs and sperm, has to be recorded and stuff like that. Of course, we are not doing it currently because, as you know, these are issues that are not necessarily new, but we've not had legislations for them in Kenya for since we started IVF in 2005. So the beauty about the current generation is everybody is doing DNA everywhere. There's the consumer-ended DNA where you really don't have to wait until you get, like personally, if I'm dating somebody, I will literally do a background check on them. A lot, criminal, nini, everything, you know, it's just the current generation. So that's the beauty of the whole thing. But what will happen in future, and you know, Kenya is also small. It's not as big as US where you can donate even 20, 30 times. Kenya, what happens is the girls, for instance, the girls who are donating the eggs, which are going to be created into embryos, are usually from Nairobi, you know, from these universities around in Nairobi. And the people who are accessing these services, because IVF in Kenya, it's not as expensive as the US, but it is expensive to a common mwananchi because we do not have insurance for IVF. So if you're talking about 400,000, 500,000, 600,000, it's not everybody who's going to afford it. So the people who are affording these are from the same circles. These are the same, and the girls who are donating the eggs are from the same circles, or the boys who are donating the sperm are from the same circles. So these are people you're going to create embryos. They're going to give birth, and this, because they're in the same circles, they are going to go to the same Javas, meet in the same universities and have, so either way, it's already a messed up wherever. So we are trying to do a database so that consanguinity and all that you've talked about cannot happen, so that every clinic knows that Ruby donated at, say, Dr. Ndegwa's clinic 3 times, and they've been her eggs have been used 4 or 5 patients. Damaris donated to another clinic 5 times, so that Dr. Ndegwa is aware that Ruby has donated here. So if she goes to donate another place, they already know. So how many times are we allowed to donate? Just before I sign off, there's someone here who asked, can siblings be surrogates? It's out of topic, but I'm tempted to answer that. Yes, siblings can be surrogate. However, to avoid the issue of incest, your sister can surrogate for you, but your husband's sister cannot do surrogacy, because this is an embryo that is going to contain your brother's sperm. So it is as good as sleeping with your brother and you're carrying your brother's child. So your sister can surrogate for you. Yes, the woman's sister can surrogate, but the husband's sister is not allowed ethically to do surrogacy for the couple.
That's in Kenya, right?
That's in Kenya. Yeah.
Go ahead.
The bioethics aspect, Ayeta, that you mentioned, you know, with gender selection and stuff, you know, I just got to thinking. So when my parents did the embryo, you know, the testing, and 3 of them ended up being very highly graded, and technically they could have picked which gender to start with because all of them were perfect, right? But for them, with their ethical mindset, they said, you know, there are so many different components, about 10 or 11 items that the embryologist looks at, right? So they gave the power to the embryologist. choose the best of the three, you know? But what happens to those embryos for people who have completed their building their families and they still have 5 embryos, you know, in the that they have frozen? You in Kenya, you call it embryo donation. Here, they call it embryo adoption. So you would adopt an embryo because it's already somebody's baby, right? It was created, but they don't need it anymore. So I think some people can donate it to research, but many people often opt to the IVF clinic. They tell the IVF clinic, hey, you guys still have our 5 embryos. We want to give it to a couple that is struggling. Maybe they both have male and female factor and they're just seeking an embryo, and it might be the easiest and cheapest way for them to do it versus the surrogacy. So then they're adopting these embryos. There will be, it's very minor. The documentation is not going to be like adopting a baby because this is just an embryo. It hasn't become one. So it's interesting the differences and
it is. We actually still
collect, you know, the thought process behind the Kenyan legalese and the American. It's interesting how different. Yet
maybe because the Americans, their legal system is more advanced than ours when it comes to these issues about assisted reproductive technology. Remember, ours is just from 2005. America has been there since 1978 or something like that. So we are trying to catch up. However, yes, we call it embryo donation. And of course, the one who is adopting calls it embryo adoption. So we use both languages.
And there's no money exchange. So here in America, another thing also, because it's human tissue, you can't sell it. So you're donating it. It has to be no financial gain from it. So.
Okay, Leah is jumping out. Did you want to ask a question that we or any final comments before you move?
I think there was a question and now I can't be seen at all. Let me just put up the video. The sun has set.
It's like those undercover cops.
Yeah, but I think there was a question about bonding. If the bonding fails, if the bonding fails, with the adoption process, if you're doing your 3 months bonding and it doesn't work out, if the bonding fails, it can be extended. You can request for an extension, and in some very rare circumstances, people have said it's failed completely. It's not working out, and please allow me to take the child back to the children's home. So sometimes, but there is support from the Adoption Society, of course, during the bonding period. But if you feel it won't work, it won't work. Parents have from, it's quite rare, but yeah, in some circumstances, parents have returned the child.
Okay. Asante sana Leah. You have fun in Shands. Let me have. So I think I'm done. My questions in my head. No, I have a question. Okay. Someone had a question about the cost implications. So because we have both the American people and Wanjiru, tuanzie na watu wetu wa kienyeji wa nyumbani. What's the cost implication of the whole process, Wanjiru, and then Damaris, you'll tell us yours.
So I think for surrogacy, I deal with the medical aspect. Ayata does the contracts for the members, so she'll talk about the surrogacy agreement between the surrogate and the intended parents. But for the IVF process, because the intended parents do have to undergo an IVF cycle, so it's like any normal IVF cycle. The only aspect that is different is that instead of doing an embryo transfer, which is taking the embryo and placing it into the woman's womb, will not be put into the lady's womb, but will be put into a surrogate's womb. So the cost is anywhere between about 500,000 to about 700,000 in terms of Kenya shillings for the medical aspect. Of course, once the woman is pregnant or the surrogate is pregnant, then there's the antenatal care. So I tell patients that you have to consider that she will be followed up until the 40 weeks of pregnancy. So you have to factor in what the OBGYN will charge for consultations. And because hers is a pregnancy that is through IVF, the consultations will be, the first trimester consultations are a little bit more. So that could be anything between 4,000 to 10,000 or even 2,000, depends on where the obstetric care will happen. Her medication, is also covered by the intended parents, as well as any problems she will have during the pregnancy. And then you also have to consider the cost of delivery. So whether she's going to have a normal delivery or a cesarean section delivery, that will also be a cost that the intended parents have to take on. Yeah, and then some are generally nice, and sometimes you'll find that they give her tokens afterwards just as a thank you. So those are, but medically speaking, it's usually the IVF cost and the antenatal care and then the delivery cost that would be factored in.
Okay, and Damaris, the cost on our end.
So for me, on the surrogate perspective, the compensation can range between 35 to 65,000 for a first-time surrogate. It can go much higher as an experienced surrogate. For the intended parents, of course, it varies greatly, but on average, most parents, if they're doing an agency, which majority of people opt for just for the, for the appropriate guidance through the process, there's the agency fees, which can range from $30,000 to $45,000 to the intended parents just for the agency. And then there's the escrow. The intended parents have to use escrow, because at the end of the day, much as I have gotten matched and I have a very cool relationship with my intended parents, I can't be talking money at mwisho wa mwezi wanilipe. It's kind of, and it would be very uncomfortable. So there is a third party that manages the financial aspect, my automatic monthly payments, and the payments involved, there's the base compensation, and then there's the miscellaneous monthly, because at the end of the day, I buy my prenatal vitamins, there's those little costs. So there's a base fee, and then the miscellaneous amount. And then somebody in the chat room I was responding to, she was asking how much will be compensated for weight gain. And I said, well, if it's a compensated one, you're not going to break down, okay, let's break it down. This 10,000 is for weight gain, 20,000 is for nausea. You can break it down like that. So the compensation, I added on there that at 17 weeks, which is next month, then I am eligible to get the compensation amount that we had agreed upon for my maternity clothes. So I have to buy new clothes, and so there's that compensation that you get. So it can add up for intended parents for sure. It's not a cheap feat doing surrogacy. It's an investment, but for me, the way I put it is, we always focus on real estate. If I wanted to buy a house, I get into a loan of 500, 600,000 mortgage, right? But if I wanted to have my own child, it's going to be much cheaper than that in terms of that. But when I look at my agency's website, they give an estimate for intended parents as between 100 to 150,000, depending on their dynamic. If they're using an egg donor in addition to the surrogate, or if it's just surrogacy. So it can add up, and for the most part, it's America. So you know how insurance is bad in terms of the cost. So the insurance companies will really demand that what they're paying for covering me is equivalent to really how much I'm getting compensated for. So it can really add up, and they are paying this package of insurance, $500+ a month, and yet I have very good insurance through my company, but my company's insurance will only cover me if the pregnancy is mine, but it's not. It's a surrogate pregnancy. So there's the cost of insurance, the travel expenses, the compensation, like what I think Wanjiru mentioned, called tokens. So here it's kind of frowned upon because the compensation package covers it to avoid any argument in a court of law that, oh, they influenced me to do this, they did that. So it's very streamlined to where it's kind of that thin line. But as you build a relationship with your intended parents, you get close, you become cool, you become friends, and there's gift exchanges, there's, all of that, and that is not frowned upon. It's acceptable. Now, depending on how much it is, it can really affect how you perceive or view your journey, and every journey is different. So if if my intended parents want a sibling because they have 2 embryos left, they can, if they are ready, we can talk about that for like a year after after this baby is born, we're going on to the next. And if they're not ready for that, Dama will be ready to look at other profiles. I can help another family while I'm still able to, because as an experienced surrogate much as I'll be past 40, since I've carried healthy and able to deliver, I can be a viable surrogate up to 45 years old, as long as I don't have any new health conditions and I'm still in tip-top shape as I am now.
Okay.
Yeah.
Sire, just put on your religious hat. I know that will only be one denomination, ours. What are your people? This is last week I dethroned you. Now you're back on the throne. What are the pastors, whatever, in your circles saying about this whole issue, both surrogacy and adoption? Na watu mtayarishe maswali. We are lawyers, we have to eat, both in Kenya and here. Yes.
So I'll begin with adoption. Majority of the Christian world is pro-choice. Okay, there are pockets that are pro-abortion, which frankly is hard to reconcile with the Bible. Of course, there's some circles do advocate for where there's a medical emergency and everything. However, the holistic, there's a big voice for what is called holistic pro-choice, and which is the idea that it's not just enough to fight for the life of the baby from conception to birth, but you need to fight for the life of that child from conception to birth and beyond. And what that means is, in some cases, the children being born are probably coming as a result of rape or some other issue that means the parents are not, the mother is not able to raise them. And therefore, there's, in quite a number of circles I listen to or belong, there's a push and a big encouragement, at least for the idea of adoption. And you would also appreciate that, at least for the Western world and for modern thought, the concept of adoption is a very Christian. It's very unique. Like if you draw off the lines, it's very Christian. If there's anything that made the Christianity to grow out of Rome, was the idea that in a culture that was extremely heavily infanticidal, heavily against female children, the Christians took them. Most of the abortion then was actually infanticide. Children were killed largely through exposure, but Christians would take in the children and nurture them and keep them going. So adoption as a concept is, one would say, as old as Christianity itself. So it's seldom frowned upon. It is seen as a part of the package of what is called being truly holistic pro-life, not just advocating for fertilization to birth, but beyond of that. When it comes to surrogacy, the main concern within many faith circles is, and I forget today I've listened to very many people, the concern is like the whole zygotes, because in majority Christian places, we believe that the fertilized ovum, the zygote is a life. That's where life really begins. And therefore just the whole indiscriminate or farming, just having zygotes for the sake of it and killing others a choice. There's an ethical concern there that does not seem to be the way to go. And we're very happy that technologies like sperm sorting is here, which now allows that, we can select the proper sperm and proceed from there, as opposed to generating multiple life forms and then being able to destroy. There is a recognition, and I like the way we started the session to show the array of situations where what we would call normal pregnancy is not possible. And so Christianity does appreciate that that's the case, and that we do believe that through medical advancements, such as in vitro fertilization, which makes surrogacy possible. But God is giving opportunities to do this. It's an extension of the idea that all truth, where something is true, all truth is God's truth, regardless of where it's found. And that God's ways of healing include, he could heal through a miracle, or he could choose to heal through the tools and processes of modern, as long as they're done within ethical boundaries. And therefore, surrogacy is seen as one of those, like the gestational surrogacy is seen as one of those avenues where God has gifted the knowledge and understanding of medicine, that it can be leveraged within boundaries of ethics to help people gain the benefit of being able to have children. And so just like with all things, the respect for human life, and the Christian comes from the point of belief that man is made in the image of God, and therefore the fact that man is made in the image of God imbues the human being with inherent dignity. So human rights from the Christian point of view is not something given by the state, but human rights in the Christian worldview is something that is inherent to the human being because they are made in the image of a true living personal relational God. And therefore, even within Christian circles, therefore, the needs of the unborn, the needs of the surrogates, both physical, mental, psychological, the needs for the parents, the would-be parents in both arrangements need to be true to the scripture, Tine, that says, I have come that you might have life and have it even more abundantly. And some of these safeguards that have been, put, like you cannot be a surrogate until you have a child of your own. Christianity's pro that, and all the other safeguards that make sure both surrogacy and adoption do not become an enabler for things like child trafficking. In fact, a lot of Christian organizations are involved in anti-child traffic and anti-human trafficking ventures, and surrogacy and adoption can be easily abused in that direction. So Christianity has a big eye and outlook towards that. So insofar as it does not veer into the area where it looks like we are farming human beings, nilly-willy, and where we are not terminating life nilly-willy, and where it's not being done as a pursuit of vanity, Christianity is not opposed to concepts like adoption and concepts like surrogacy.
Haya, maswali zangu yameisha ngeli mbaya, but can someone help out Zach on the sperm sorting? Wanjiru, I think it's not legal in Kenya.
Yeah, but I don't even think we have the technology yet, but and I don't know if it works very well, to be honest. But I just want to say something, Posa, because I really, really, really like what Saya says. You're so knowledgeable. And biblically and everything, we really try to stay within the confines of biblical ethics, even at our center, but I'm sure surrogacy, when I came into this, actually, Posa, I told you, my mom sent out and she was like, what are you talking about? And I'm like, I'm talking about something that I really am passionate about, because if, Posa, I didn't have a uterus, I mean, why shouldn't I allow someone else to carry and help me get a baby? And I think that is the thing that we need to, I think there's a lot of ignorance about what we do in IVF and what surrogacy means and what egg donation means and what all these things, until you have a couple struggling in front of you, a couple who maybe I got TB and my uterus is now closed because of pelvic TB. And it's not, I didn't go out and look for the TB. TB is rampant in our community, yeah? And I just got it. Why should that person be punished because of an infection she got? So, I mean, I love what he said, that we have been given knowledge, medical advancement. The only thing that we must do is use it within ethical and religious confines. We must not pull away from what is true which, I mean, depending on where your ethics or your religion comes from, you must not pull away from that, that if it's surrogacy, can we do it within the confines of assisting a couple, but also ensuring that the surrogate is well compensated and is taken care of and lives dignified, you know? And that's what this whole thing is about. Surrogacy, you know, I think she also asked me, does the blood interconnect? And I told her there's nothing, there's a placental barrier. The baby does not have blood cells that go to, I mean, the mother does not give the blood cells to the baby. In fact, that placental barrier prevents infections, prevents blood crossing to the baby. The only thing that does go there is nutrients, and excretion from the baby comes out. So I think there's this whole notion that it's, you know, there's some cross contamination or something, that the genes are being transferred to the baby, but that is not the case with surrogacy. It's a lovely, wonderful, wonderful gift for couples who cannot conceive. And I cannot wait for this bill to become passed as law, because it's a gift that should be given, but of course within confines of ethics. Thank you.
And I would like to challenge us as Kenyans to just love reading, love knowledge, because some things we say are out of ignorance and we will spend 2.5 hours watching people abusing each other on Facebook Live, but we will not spend the same listening to this conversation. So that's one. And the second thing, as Mutindi, you and I went through University of Nairobi, and until I started practicing on my own, I had never thought of infertility as a big issue. Why? The nature and the crop of patients we get to practice on, those are not their issues. So I feel like on top of just educating the masses, we also need to educate the GPs, the other professions that are not OBGYN and that are not fertility experts, who don't see this as a problem. The other cadre of people I want us to educate are church people. I mean, the Catholic song goes, watoto wako watafanana, as in we are already assuming that you're gonna get, like, fertility is guaranteed. And our mothers and our mothers-in-law, the pressure we put upon couples, as in we start after month 1, tushaanza kuhesabu, utapata mtoto lini. They do not know the amount of trauma, the amount of anguish couples fighting, struggling with infertility go through. I think I am done. And like I always say, as I represent my tribe, we need to eat. So the panelists, do you have questions for each other? And then if you are in the audience, wasikilizaji, watazamaji, wapenzi, you can actually raise your hand and we'll give you permission to ask your question. Panelists, do you have questions? Yes, go ahead.
It's not a question, it's just to emphasize on some of the things that have been already said. For instance, when IVF started in Kenya in 2005, and by extension, surrogacy started in 2007, of course, the Catholic Church was up in arms and, and had all issues and bagel. But at the moment, if you may, it is very interesting that the person actually pushing for this bill is a staunch Catholic, Millie Odhiambo, and she's the one who complained at the first time, and right now she's at the forefront of pushing for the assisted reproductive technology bill. So I think education has come a long way, and people have already been told about all these and stuff like that. The next thing that the gentleman spoke about child trafficking and surrogacy, it is very true. Surrogacy has been used a lot in child trafficking, especially in countries that do not have laws. And that is why I'm with Dr. Wanjiro that the bill has to be passed into law as soon as possible. Because as you may know that Kenya is on tier 3 of child trafficking, it is the source, the transit, and the destination for trafficked children. So it is something that people just using names and all that are using, so that there's trafficking and spam like that. Finally, yes, we have a spam sorter in Kenya, not just a spam sorter. 3 facilities already have spam sorting. And that is one easy way of and ensuring that children, when you're doing PGS, you must create the embryos first before you can conduct PGS. But the beauty about sperm sorting is you will get if it's a genetically related disease, because most of these PGS and sperm sorting is ideally for medical reasons, not just for social balancing and all that. So people have to be ethically balanced to be able to use this the way it's supposed to do. But as Kenyans, maybe it's just Sharia that we'll have to bring into place so that people just don't use it for social balancing. But yes, we have sperm sorters. Yes, you can use it so that you create or do fertilize with the necessary sperm so that you don't create embryos, which now will have to be either discarded because they are not needed or because you have too many and you do not want to use them. Thank you.
1-0. Do you have yeah, unaweza tufungia ukurasa wako, or if you have any questions for any of the panelists?
Oh, for me? No,
yeah.
I just wanted to ask, anyway, I wanted to ask Ayeta about the number of times a surrogate can carry, because I don't know if that is in the bill. Sorry, that's what I would want to ask.
The bill, at the moment, the bill has said that it depends on the number of children you have, because if a person has one child, then they can carry 2 times or 3 times. But if a person already has, because it's not just about the surrogate or the intended parent alone. If the surrogate already has 3 children, then she can only gestate once. If she has 2 children, then ideally, you must not give birth more than 4 times. In short, that is what the bill has said at the moment, but it is still up to discussion because some doctors said you can, some doctors in the panel said you can go as many as 6 children as long as you have not done CS. In fact, one of the fertility experts had even told us, oh, we should actually cap it at 18 years. Mtu aanze tu kuzaa akiwa 18 years. And people were like, that is ethically wrong, because now people will be going to high schools to recruit those small girls to finish Form 4 immediately and start giving birth. So I insist what Dr. Wajiro said, ethics, ethics, ethics. You may be doctors, we may be lawyers, but at the end of the day, we are humans and we need to have the ethical guidelines to ensure that some of these things, we use them as God gave us, but use them in an intelligent and ethically manner.
Damaris, kiwanja ni uwanja ni wako.
Yes, that prompted me, Dr. Wanjiru, with a number of pregnancies. So for America here, a surrogate, they factor in, okay, so how many pregnancies total is the surrogate allowed? So some surrogates already have 4 children and they can be surrogates. It has, the max is a total of 8 pregnancies. So my coordinator with my agency, and all the coordinators in agencies usually have been surrogates before. She has carried 2 sets of twins, and she's had a singleton, and then she had a journey where she had a miscarriage kind of late. So she counts that as well, of course, because it is an angel. But yes, the number of pregnancies, and then we also limit the C-sections. So as a surrogate, I cannot have had more than 2 C-sections in the past. I haven't had any before. But each clinic has its own guidelines, but it goes off of the national guidelines for surrogacy that each of the clinics have to ascribe to. But you will see the BMI of the surrogate. How much should it be? How old should they be? How many pregnancies they've had? They should not have had, if they've had a miscarriage in the past, maybe they might consider the situation and kind of waive that. But if they have, so if they were also diagnosed with gestational diabetes with their own children when they were carrying, that disqualifies them as a surrogate in the future. Preeclampsia, that disqualifies somebody, you cannot be a surrogate. But yes, it's interesting how many pregnancies I can carry as a surrogate compared to Kenya. Then I find that very interesting.
Okay.
Yeah.
Velma's question on the birth certificate. I know it's not in our field, but I think someone needs a birth certificate and there's no father. I know, like for my niece, we did not put a father figure on theirs. Can she just go to the authorities and just put the name of the mother, because maternity is guaranteed, paternity we are never sure, and just leave the father's bit blank? Ayeta hii hapa ni yako.
Birth certificate, you can take it in the mother's name. If my sister has a child who is required to register, she does not know the father to her child. Oh yeah, you can take the birth certificate in the mother's name alone. And then once the father is identified or discovered, then all they need to do is go with either a court order to show that to claim parentage. It's a very simple one-step court process, or with the ID of the father physically present to include that. But at the moment, go with the birth ID ya mama, awekewe birth certificate. She just takes birth certificate. And birth certificates nowadays, Vera, you don't actually have to go to the place to apply. You apply on eCitizen. Because you're late, because the child is already 16 years, you pay fine. I think it's 150 shillings, and then you go to house if you're in Nairobi, and then they'll just create for you a birth certificate instantly. It's not a big process. In fact, we encourage people as late as ever to take a birth certificate whenever, wherever.
Okay, and in terms of agencies that help finance, I don't think it's a need in Kenya, so I don't know. Wanjiru, is there anyone funding anyone to have surrogacy and IVF in Kenya?
In terms of what? An agency?
Paraphrasing. IVF is very expensive due to limitations from insurance and NHIF in financing. Are there organizations that can provide financial support? I don't think I've had. Are they there?
No, so actually, people are getting financial support from some insurances. Right now, corporates, which is what people who are employed are doing a lot. Safaricom, StanChart through the insurance policies, and some other, and even some NGOs and even some parastatals are actually paying for people to have their IVF cycle. So I think it's a push that we should push from our employers. But it is, there are, but in terms of other financial aids, I'm not sure, but I do know that a lot of insurances are taking it on board right now.
Oh, that's nice. Okay.
Yeah.
Okay.
Yeah.
Even government is really paying for especially the armed forces and the teachers. Government is really paying for them for IVF services, and you are allowed actually to go 3 times. So
yeah.
Hey, Kenya, I'm so proud of you as a country. Very, very proud. Okay. Wapenzi na wasikilizaji, watazamaji, do you have questions? Because we need to, it's been 2.5 hours. I know. Do you have any questions, or I call my Mutindi? I've seen you've unmuted, Enda.
So I just so for me, I'm not married, no kids, and there's a cousin of mine who had a rare thyroid disease that required her to have a liver transplant, and it's a total liver transplant in the US. And so whatever medication she was given required a hysterectomy later on. And so she came to me and said, can you be a surrogate for me? And I was like, yo, no problem. But all the doctors in Kenya refused. Yes, because I do not have children. I don't have any prior pregnancies. I'm not married. So I think in my 40s, I am 46. So for me, I think the ship has sailed for kids. That time I think I was about 38, and I thought, yeah, I can. I don't think I don't have very strong maternal instincts, but it was my cousin, and her sisters are morbidly obese, morbidly over 100 kilos. And she said, I want you to carry. I don't want any fighter, or anything. Yeah, but yeah, all the Kenyan doctors I spoke to refused. I didn't have a problem with it, but apparently, yes, because I don't have children, they thought I might snatch that baby, which I wasn't going to. But yeah, I think the law is very clear. And I think it's interesting what's her name? That lovely lawyer with that lady. What's her name? Ayeta. Yeah, so I think there's something, I think in that time, I didn't think about the fact that, hey, I could get pregnant and, lose my uterus or anything. But for me, she was so desperate to have a child. And to date, she still has her embryos frozen in South Africa, hasn't gotten a surrogate. But then I think I have referred her to a few doctors. So I think right now, either she's probably not keen on it anymore after we spoke to a few doctors who said, no, Tindi, you cannot carry, you cannot be a surrogate because you've never had children. So we let it rest. But this has been an informative discussion because a lot of people, women come asking about surrogacy and say, where can I go? And sometimes I'm like, I'm trying to judge their reasons for wanting to be a surrogate. And some of them sound really dangerous, I said in the beginning. It's when I listen to Damaris, I can hear someone who wants to, and oh my God, I think your accent is so amazing. I have to ask, is she Spanish or Jamaican? Actually, she's Kenyan. I'm hearing Jamaican and Spanish. So I hear you speaking as somebody who it's not for the money. I want to help. Okay, nothing wrong with getting money, but there's a heart that and a feeling and a vibe I get from you that this is really something you want to do to help others. You know, you can't really judge, and I'm not a psychologist to judge. So I think it's something people have been asking. I don't know where to send them. So glad to know that my colleague, Dr. Wanjiru Ndegwa, is somebody I can refer to. The other person I've been calling as a colleague, I think, is Dr. Kireki, because I think he's actually been featured on TV, having worked with women with surrogacy. Yes, so I am the same field with Wanjiru as a gynecologist. And so for me, infertility, oh my God, it's so heartbreaking. So for me, I found it such an emotive specialty to get into. So I ran away from it, but I'm now in a specialty where I'm managing complicated pregnancies. So a lot of IVF patients, currently I live in Eldoret, I moved here to school. So a lot of patients from Medihill who do IVF, who can't afford private care, are coming to us, and we are following them up with the scans. As you've said, they are high-risk pregnancies. There are those who, it's twins, it's triplets, and we tell you, admitting you for 6 months, Kunalinda Mama will pay. So for me, what I'm doing now is highly connected with the fact that I manage high-risk pregnancies coming from Dr. Wanjiru specialization, that is infertility. There are those who will have below risk and so will be managed. So for me, it's not something I brush off. I get to see these women. I get to see how heartbroken they are. I get to see the pain of not being able to have a child. And for me, it's such a pleasure to say, can you go and see Dr. Wanjiru Ndegwa? And when you come back to me and say, okay, I'm knocked up, it's such a joy. So it's not something that I overlook. And of course, there are those who, look at me like, oh, you okay not having kids? I'm like, yo, that ship sailed a long time ago. There are patients who come to you, like, come at you. But you have to work with them and empathize with them. It is an emotive affair. So for me, it was too emotive. But then I'm doing a course which is super emotive. So I'm like, what the hell was I doing? Should have done oncology. So yeah, walikata mimi ni quest surrogate. Mimi singekuwa na shida, lakini kina Wanjiru walikataa. Na ni sawa tu. Anyway, it's not they
told you,
anyway.
They told you the truth. It's an emotive subject. Damaris, go ahead. And for the people, yeah, go ahead. No, I'm just saying for the people who wonder, we covered many topics. So please subscribe and like. Si lazima tuende madukani. Yeah, and then please inbox us. We will look for a panel. Yes, that doesn't.
Dr. Mutundi mentioned South Africa, and it got me to thinking South Africa is actually the only country that has very well-established surrogacy laws. And I follow a surrogate that is on her second journey right now on YouTube. I forget her name. So that reminded me of that. And so if her embryos are in South Africa, she even has a better chance of getting a carrier in South African carrier. Mm-hmm.
Yeah, she wanted, I think, like what Wanjiru said, in terms of it's almost easier to use a relative or family member because there's not much below in terms of legal work and stuff like that. I think that's what she wanted. So because I told her, you're even in the States, for crying out loud, and she said, no, I'm here now in Kenya and I don't want to be, someone is there and I'm here. And she works for Microsoft. So anyway, she's now 50. I think that ship sailed for her. So I don't know I think her embryos are just chilling there. I don't know what she's going to do with them. Yeah.
And how long can these embryos chill, Wanjiru?
Sorry, how?
How long can these embryos, with the new vitrification procedure, how long can embryos chill?
I'm very impressed that you know vitrification, but that's good.
Even
So
I didn't know that.
vitrification, to be honest, it's there's no limit right now. I know there was a baby who was born of donated embryos in, I think, Canada or some country that had been there for 30 something years, and that was not even vitrification, that was slow freezing at that point. So 32 years. So I mean, we have no limit. I hope the law comes in to guide us on to how long we can keep stored up embryos, but right now, no limit yet.
The law says, the bill says 10 years.
10 years. Good.
But that's
Thank
for
you.
slow freezing, Ayeta. Ayeta,
No,
slow
the current bill says 10 years. It's not because of the technique. Listen. It's not because of the technique. It's because of the best interest of the child. If I freeze my embryos now, I'm a 40-year-old woman myself.
Yeah.
If I freeze my embryos now, 10 years, I'll be 50. Am I eligible to be a mother then, or am I a grandmother? And if I'm going to donate, is that my child or someone, it's not just about the freezing. It's about the best interest of the child. But for eggs, you can freeze up to 30 years, but that is what the bill says. It hasn't become a law yet. So
what happens to those
there's room for
embryos?
negotiation.
Yeah, so what happens to I know that
there's
Naomi Campbell getting their children at 50, and we follow them and we want the same deal. So what happens to the embryo? Are they just destroyed?
There are many ways of disposing. The most fertility centers I know dispose of by donating to other couples that cannot be able to wherever. But what the bill is saying is, at the moment, we will also have research. We have research facilities for stem cell and all that, so that other embryos can be used for stem cell research, so that other things can also be cured through the process. The other third option is self. You get your embryos in a container. You make maybe prayers. I'm not sure what Saya is. Was it called Saya? What Saya will say of this? You make your own prayers and decide to, let them die a natural death or something like that. That is something the clinic cannot do. It is you as a person to come and pick your embryos and do.
Okay, we need to close. Saya tufungie. We need to close. Saya tufungie.
Okay, thank you everyone for being here. Broad panel. This was like a true consultation of the entire adoption process in America and in Kenya, and also of the surrogacy process in both countries. If you listened live and watched live, please feel empowered to check in with any of the consultants. Depends whether you need gynae help or you need legal help. The lovely ladies have been so kind to donate freely of their time. You almost can tell if they were to charge that, they should cost it at an arm, a leg, and yet to be disclosed internal organ. So I think the least we can do is, if we need their services, please let's use them. And also, if you know somebody who can need their services, please feel empowered to point them in that direction, because frankly, they know their stuff. So why do you want to go and use people who will guess? Dama, thanks, singling you out in a special way. It's one thing for us to hear the legal and the medical. It's another thing to have somebody who's going through the lived experience to be vulnerable and share with knowledge, thoroughness, and detail as you have. We totally appreciate. Our legal experts, thank you so much. Most legal statements begin with, the law is very clear. Then they tell you 10 minutes of things that are next to most unclear things, but you've been very clear on the process, and thank you so much. Our endocrinologists, thank you for, and gynae team, thank you for making it clear to us that, I've not had a single word like kurogwa, or that's being bewitched, or somebody looked at you with a bad eye. You've been able to break down and remove the mystery from the medicine, so that it is something that we can see it's mitigatable. So thank you everyone for leaning in with your expertise. And thank you, Paul, for bringing together the team. And thank you for running the session. So once again, children are a gift, and there are many ways. Gifts come wrapped differently. Some just come directly, some is a bit more elaborate, some are delivered by UPS to your door, some you need to go to the store to get them, but children are a gift. So for some of us to get to that gift may be a bit of a process similar to what was there today. I just pray that we've been able to get more knowledge and more information to do that. And I don't know, but I sense somewhere within me that if you got your child through adoption or surrogacy, maybe your level of appreciation for them will go a notch higher. And why not? If God gives you the opportunity and chance to give the privilege of parenting to somebody you adopt, I pray you may be able to embrace it well. My final thoughts on today's topic is going to be a very aged title. In high school, I did a book called, our Swahili story was called Siku Njema. That ages me. We were the first lot to do Siku Njema, written by Ken Walibora, the late Ken Walibora, very high level Swahili. And it's basically the story of a guy who spends his entire life trying to look for his father. He's grown up with his uncle. He's grown up in the midst of a lot of jealousy. And you see the turmoils, the ups and downs. And the story, of course, sadly ends. He finally gets his father, but he gets his father when the father has just died. But the father has left a note to it. And when I was reflecting ahead of today and just thinking about Siku Njema, Siku Njema, for those who don't know, in Swahili, it means a good day, a great day, a better day is coming. So it's the story, the idea of getting my father would be a better day. This individual, there are very many people who could be potential fathers, whether it was his uncle or friends along the way, who missed out on the chance of being a father to him. And I still keep thinking, how many people would find their Siku Njema, their good days, by you becoming the parent in their lives? So I hope surrogacy and adoption gives you an alternative to be able to create a Siku Njema, a good day for somebody out there. So in a fortnight's time, 2 weeks from now, we're going to have our next topic, which is going to be on trauma bonding, and what it means and why we should be concerned about it and what we can do about the same. You might end up finding that your past traumas have made you become dependent in a certain way, and individuals you think you love or individuals you think you are giving yourself to may end up not being really loved, but it's you bonding with them as a result of their traumas and your traumas or just your traumas. And it's time to dig deeper into that. You will again find your link and your invite through more or less a similar channels you did. But if you don't want to be dependent or be on the learn these things by rumors, why not subscribe? It's a way to support the work we're trying to put there. So you can get this recording for today and past recordings on a special channel, YouTube channel for this. It's called Authentic Dialogues. Just look it up and you'll find this and previous sessions. You can also subscribe to our Facebook page. It's called Authentic Dialogues with Saya Jackson. And on Instagram, it is at @1Saya Jackson, and the same handle on TikTok. We look forward to you sharing your ideas, your feedback, your thoughts, suggestions on topics, and on speakers. That would be something worthwhile. We normally have a small window after this where individuals can ask questions. They don't want to go to the World Wide Web. Noticing that the time has gone quite considerably today, we will keep that, we call it behind the tent. We'll keep the behind tent session today a bit shorter, but yeah, feel free to stay behind and ask your question thereafter. Otherwise, once again, thank you so much for your time. And again, the difference between making a Nero and a Bill Clinton is really in your hands. Be blessed.
Asanteni. My attempt today will be just 2 minutes in case you have a question that you don't want to make it to the interwebs.